Alrighty, hopefully everything works. I'm gonna hope so at least. Shit. Was I'm like kind of fucking with my audio today. I'm just trying to like make it sound at least a little bit better because I can feel things being weird. Oh my god, hey Boba Lover, congrats on getting first. Holy shit. Damn, it was you and Bone fighting for it, I feel. Congratulations, you're both here. Holy. Hi. How y'all doing? I like tried to take a nap, so for real. Didn't really work out. Ended up being like a 5-minute nap. So that's how the news goes, you know? Right. But hey, it's okay. It's okay. I'm here. We're all here. I'm gonna be yapping about pharmacology and like other shit so that I can at least remember everything, basically. Yeah. How are y'all? All doing good? Me, I'm doing pretty fucking well. Passed most of my exams. I passed like basically everything, which is nice. Let me switch over after the outbreak. But yeah. Yeah, hi. Hello. How are y'all doing? Are we doing good? But yeah, no, absolutely. Oh, we're going to do study for an exam? Oh my god, so we're actually both studying? This is fate, as some may say. Amazing. Crazy. But yeah, of course. So basically, I'm just gonna have I'm just gonna have this on. I'm gonna yap while what I'm reading, that kind of thing. It's very low key, very low key. This is just. Oh my god, acoustic. Hey, hi. It's okay that you couldn't catch a few streams. Honestly, I'm glad that you weren't there for Monday's stream. You should not be there. Do not look at the VOD. Do not witness my shame. Oh, alright. Alrighty, Ennui. Have a good day. Do not look at the VOD. Do not do that. No. No, 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 no. Don't you fucking dare. I mean, I can't really stop you, but no. Wait, you're studying for exams, dude. Do not, like, you don't have to. I promise you, you do not have to. Rico! Hi! How are you doing? Hey, how are you doing? Shit, sorry, didn't mean. Oh, you got me on mute? Oh. Rip. Oh shit, have fun! Good luck! Good luck! Hell yeah, Rico. Good luck, dude. I'm so excited. Yeah! Oh my god. Okay. But also, if you don't take any clips of the actual recording, I'll be happy with that. But if you want to torture me, I know what you're gonna do. I know exactly what you're gonna do. I know what's gonna happen to me. So it's like, well, shit, you know? But yeah, so I just have to like read over everything for finals now because it's like, oh my god. I'm not looking forward to PD tomorrow, physical diagnosis tomorrow, because I'm fuck. Yeah. Do not. I know that you're clipping everything that's embarrassing. I know you want to witness my shame. Some days, I wish you didn't. But also, that's just kind of how it is. Oh wait, I gotta make sure that the channel goal thing that I set up is working. Wait a second. Okay. Because I have a new one because of Kel's. She gave me a funny idea. So I know what's gonna happen. And I figured out like how to make like rewards actually viable or like actually possible for you guys. So it should be on. It's starting now. It's starting now. No! No! Also, Sucho, hey, hello, welcome in. And oh my god, thank you so much for the 13 total bits. Oh, by the way, Sucho, the thingy works now. Your stupid fucking emote works now. Yeah. Your stupid fucking emote works now. It's there. You're welcome. Now you have it. For those that want to torture me by subscribing and using that emote, fine, go ahead. I'll allow it. I will allow it this time. What the fuck? 4K already? Jesus. Jesus Christ. Already? Literally. Okay. Okay. But yeah. There's the goal now. Have fun. I also have some new ones in here. I hope they get... Yeah. Yes. Your emote, it's here now. Your emote is here now. I also have... I think I actually activated it. No, I did not. I should activate it, because I'm actually really happy about this one. Did I not activate it? Wait, where is it? Where is my bicep curl? Yeah, it's there. 50 points. Like, make me, like, do a bicep curl. There it is. Yes, yes. Also, thank you so much. I'm sorry, Kels. Hi! Mr. Manager, hello. I passed all of my exams, and I was like, you know what? Fuck it, I'm in a good mood. I might as well stream, you know? But yeah, so basically, thank you. I will do one bicep curl on the right arm. Okay, I'm doing it right. Jesus! Wait. Okay, so you want both arms? Okay, well, do that. Specify that, because I will do both at the same time. Okay. It's only like a, what? 4 kilogram weight. So it's fine. So, wait. I'll do 1. And 2. There we go. That's the reward. That's the redeem. I mean, yeah, they really didn't. Internal medicine and fucking physical diagnosis and psych and PD, easy. Wait, you also wanted me to do bicep curl? Okay, fine. Wait, and third. I did right, left, right. I did all 3. I try to like make sure to keep good form even though I'm just sitting at my desk, so. Yeah. So yeah, this is what today is. It's just me yapping while I'm reading my notes. Yeah, so basically we're just gonna go through all this bullshit. And thank you so much, Mr. Manager. I am actually very happy about this fact. I was like, oh my god. Also, yeah, no, I was shook. I was very shook about that, about all of that. I was like, wait. Even Patho wasn't as bad as I thought it was going to be. I got like 1 point at, I basically got straight 75%, which honestly, considering my track record with pathology, that's already an improvement. I'm gonna be so for real. I hate patho with a passion. It doesn't make sense to me. That kind of thing. Yeah. But yeah, so that's why we're just yapping here today while I'm reading. But yeah, so I was just gonna look over like some stuff for the exams basically. So I also have to like work on writing some Q&A stuff for the my research presentation. Basically like to predict whatever the fuck those exams are gonna be. Oh shit. What? Okay, I don't understand what those booster pack things are, but if you find them interesting, I'm glad. I just kind of put stuff on the stream and I try to figure out what works. Can you tell how haphazard everything is? Everything is haphazard here. My whole life is haphazard. That's like the whole tea here. Oh, Jesus Christ. What? Why would you throw it right at my face? What the hell, man? Thought we were friends. Fuck you, dude. Fuck you, Bones. It went straight to my head, dude. What? Now I'm bald. Great. I mean, yeah. It does take a minute to throw. It does take a little bit. Fuck it. We might as well just read the fucking textbook. Would this be considered ASMR? Probably. Will I ever do ASMR again like the one stream? No, never again. For free, at least. That ain't happening for free. This is all you've learned from me today. But okay, so introduction to neurodegenerative disorders. Neurodegenerative disorders are characterized by progressive and irreversible loss of neurons from specific regions of the brain. Yeah, if someone gives me money, yes, I'll do it. Literally do exclamation point gank. Lord. Like, if you do the exclamation point gank thing, you will see that I do have a thing where if you like give me some money, I will record something for you. I'm not even joking. Yeah, it's right there. It's right there. You just gotta click the link. Oh, thank you so much for pinning it, Bone. You're like best mod ever. I appreciate it. I just realized I don't have my glasses on. But yeah, so neurodegenerative disorders are characterized by progressive and irreversible loss of neurons from specific regions of the brain. Prototypical neurodegenerative disorders include Parkinson's disease and Huntington's, where the loss of neurons from structures of the basal ganglia result in abnormalities in the control of movement. Alzheimer's disease, where the loss of hippocampal and cortical neurons lead to impairment of memory and cognitive ability. And ALS, where degeneration of spinal, bulbar, and cortical motor neurons result in motor weakness. Oh god, I'm scared. What is the funniest thing that you could do? What are you doing? What are you doing? I'm starting to regret posting the fucking link, but also if you actually do it, I will be very happy. But now I'm scared what you're gonna do. Because you scare me sometimes. Firelord Zuko, hello, welcome in. How are you doing? I don't know why you're so obsessed with hitting me, but you know what? That's fine. But yeah, so there's that. You just want me to live in fear, Sucho? Like, is Jesus. Is that the tea? Is that what I'm learning? Is that what you like? I'm starting to figure that out today. Yes, I am saying that. I was just wondering, like, yeah, I was just wondering, because that's like, it's okay. I'm just curious, like, people like to redeem specific things. People like to redeem specific things, and sometimes I'm like, I wonder what makes them want to redeem that, you know? It's just, you wouldn't say obsessed is the right word. Okay, fair enough. Okay, then what would be the proper word to thank you, Kit Kat. Hello, how are you doing? Jeez. Why? How dare? Fuck. Damn it. Jesus Christ. Man. It's bully day. Why are we bullying me? What have I done wrong? Okay, name one fucking thing. Because I don't think I've done anything wrong here. I think I've been the best person that I could be right fucking now. For the most part, currently available therapies for What? What do you mean I was supposed to talk in an anime voice? When? Wait, did you redeem that? Right now? Oh, fuck! Oh my god. I'm so sorry to whoever redeemed the, anime voice. I'm so sorry, Boba. I didn't realize. I didn't see it in the chat for like a moment because it got full of throwing things at me. Redeems. I'm so sorry. It was not my intention. AK, alrighty. Alright. Everybody bullied the stream for not giving people what they wanted. I'm so sorry. I didn't know that I did something wrong. I'm gonna stop. I'm gonna stop. I'm gonna stop. I hate that voice so much. That's why it's supposed to be a big fucking number. And then I realized a lot of y'all have really big fucking numbers of points. But yeah, so like... But yeah, there is that channel goal thing. I thought 6,700 was already a really big fucking number. What do you mean? I would like to know exactly what you mean by 6,700 is not a big number. That's a very big number of points. When there's a will, there's a way. You know what? Fair enough. I stand corrected, I guess. Shit. But still, I didn't know, man. I was... There are redeems that cost... Oh. I don't think you understand. There are redeems that cost 1,000,000 points and people will save their points to pay that. Okay. Fair enough. Fair enough. But also, cows. But yeah, like, there is the thing that can torture me. Both of these things torture me, but you have to think of a big ass number that people don't want to rank up. I mean, that's why I put like the fucking end stream at like 100,000. Because I don't think people are gonna get that number. Granted, y'all got to 80k, so maybe I don't know anything. Never, because actually that was a relatively new end stream thingy. For the most part, currently available therapies for neurodegenerative disorders alleviate the disease symptoms without altering the underlying neurodegenerative process. But a new era of disease-modifying treatments targeting the molecules implicated in pathogenesis is beginning with the approval of the anti-amyloid beta antibody aducanumab for AD. Fair enough. I could put the anime voice at 500,000. I forgot how to change the point thing though. Like, I have to look up how to do that. Now I'm lazy. But I appreciate it, really. And also, thank you so much for checking in. Jesus. Yes, I'm drinking water. And y'all better drink water too. Don't forget. If you don't, I'm gonna stare at you this whole time. No glasses too. Okay, fair enough. This stare doesn't scare you? That's okay. It's fine if it doesn't scare you. If you want a creepy stare, have a clown do it. Fair enough. This is a customizable model, so I am still limited in the things that I can do. We gotta remember that. Oh no, you did. You told me that yesterday. I think you told me, not yesterday. I think you told me that on the day of the curse stream. My Monday, your Sunday stream. I think you told me that. But yeah, I'm happy for you. Hell yeah. Yeah, so let's look at some common features of neurodegenerative disorders. Proteinopathies. Each of the major neurodegenerative disorders is characterized by accumulation of particular proteins in cellular aggregates. Alpha-synuclein in Parkinson's disease, amyloid beta, and the microtubule-associated protein tau in Alzheimer's, TDP43 in ALS, and Huntington's disease. The reason for accumulation of these proteins is unknown and it is unclear, in most cases, whether it is the larger cellular aggregates or smaller soluble species of the proteins that drive pathogenesis. Striking feature of neurodegenerative disorders is the selectivity of the disease processes for particular types of neurons in different brain regions. For example, in Parkinson's, there is extensive destruction of the dopaminergic neurons of the substantia N, where neurons in the cortex and many other regions of the brain are less affected. In contrast, neural injury in what the hell is this? What the fuck? Neural injury in Alzheimer's disease is most severe in the hippocampus and neocortex. And even in the cortex, the loss of neurons is not uniform but varies dramatically in different brain networks. In Huntington's, the mutant gene responsible for the disorder is expressed through the brain and many other regions and organs. Yet the pathological changes are most prominent in the neostriatum and the cortex. In ALS, there's a loss in spinal motor neurons and the cortical neurons that provide their descending input. Yeah. I do like Sega a normal amount. I like other things just as much, but I do like Sega quite a bit. Yep. So the background is a background that I got from Caltera Studios, and the things in the background are AOT, Sega, GTA 5. I've never actually watched JJK. But the reason why I like this background is because it's very similar to my actual space. Very similar to my actual living space. But it's like cooler. I'm sorry. I've just never watched JJK yet. I haven't had time. Yeah, it is bigger. That is true. But would you rather me use my old background? Pete, you know why I haven't watched that anime yet. It's because I don't have time to watch anime. I'll watch Jujutsu Kaisen eventually, but still, I don't have time yet. But here's the thing, I do have other backgrounds. I just think those are kind of, if are not as great as, are not as good as this one. I have backgrounds that I have made in like a different thingy. There's, where is it? I know it's in my stream assets somewhere. Yeah, here's the one that's also close to mine. Okay, wait. See? This is my old background. No. Kel's Peach Demon A does watch anime. I also watch anime. I just don't have enough time right now to like dedicate any more time to watching anime. Yeah, Kel's watches more anime than me. What the fuck? Wait. What? What the hell happened to my background? I literally just had it. Oh, wait, I know why. It has to loop. There we go. Yeah, nah. Kells watches anime. This is more like my actual situation where I live. It even has the balcony. Like, look, I can be out on the balcony. Oh, wait, fuck. Didn't mean for that to happen. I'm not gonna go on the balcony just yet. But I do have a balcony. I do have a balcony. Middle Alt E. There we go. Yeah, look. I can be out my balcony. I can be out there right now. The funny thing with this and my model is that with how transparent I am, I will literally fade into the background. Which is funny, for me specifically. That's why I like it. But I like the new one because it just looks cooler. I'll be so fucking for real. Yeah, in ALS there's a loss of spinal motor neurons and the cortical neurons that provide their descending input. The diversity of these patterns of neurodegeneration suggests that the process of neural injury results from the interaction of intrinsic properties of different neural circuits, genetics, and environmental influences. The intrinsic factors may include susceptibility to excitotoxic injury, regional variation in capacity for oxidative metabolism, and the production of toxic free radicals as a byproduct of cellular metabolism. But yeah. Shit's cool. I do like anime. I mean, I'm up to date on Freerun. I'm also up to date on Apothecary Diaries. And there are some others. But yeah. It should play my music more. Why is it not doing that? Playback, order, random. There we go. New music. Genetics and environment. Each of the major neurodegenerative disorders can be inherited due to genetic mutations, but how commonly this occurs varies widely among the diseases. Huntington's is exclusively genetic. It's transmitted by autosomal dominant inheritance of an expanded repeat in the Huntington gene. Nevertheless, environmental factors importantly influence the age of onset and rate of progression of Huntington's symptoms. Parkinson's, Alzheimer's, and ALS are usually sporadic, but for each there are well-recognized genetic forms. For example, there are both dominant and recessive gene mutations that give rise to Parkinson's. While in Alzheimer's, mutations in the genes coded for APP and the presenilins lead to inherited forms of the disease. About 10% of ALS cases are familial, and most commonly are going to be due to the mutation in the C9orf72 gene. Outbreak. Soon, at least. There are also genetic risk factors that influence the probability of disease onset and modify the phenotype. For example, the APOE gene genotype constitutes an important risk factor for Alzheimer's. Very common alleles of this gene encode different isoforms of APOE protein, and an individual with even one copy of a high-risk allele have a several-fold higher risk of developing Alzheimer's than those with the most common allele, theta 3. In Parkinson's, risk factor genes include alpha-synuclein, which is LRRK2, tau, and GBA, among others. Environmental factors, including infectious agents, environmental toxins, acquired brain injury have been proposed in the etiology of neurodegenerative disorders. Traumatic brain injury has been suggested as a trigger for neurodegenerative disorders. At least one toxin, MPTP, can induce a condition closely resembling Parkinson's. But more recently, evidence has linked pesticide exposure with Parkinson's disease. Exposure of soldiers to neurotoxic chemicals has been implicated in ALS, and this is a part of Gulf War syndrome. And we are going to go into approaches to therapy pretty soon, after the 90-second break. But yeah, I'm just chilling, I'm just yapping, you know, the usual. Also, guys, ADHD moment. I'm actually really excited. I'm gonna hang out with one of my friends later on today. Or tomorrow. I'm actually very excited about that. I'll be like, yay! Friend time. Like, I am actually genuinely shook about it. Not really shook, it's more like I'm just very excited. Yeah. Okay, let me wait for the break to come back. I'll wait for y'all to come back from the break. It's like 12 seconds, right? Alright, you're back from the break. Hello. So, okay. Many of the existing therapies are neurochemical, aiming to replace or compensate for damage to specific neurotransmitter systems that are selectively impaired. For example, dopaminergic therapy is a mainstay of Parkinson's therapy, and the primary agents used in Alzheimer's aim to boost acetylcholinergic transmission. The goal of much current research is to identify therapies that are neuroprotective and can modify the underlying neurodegenerative process. One target of neuroprotective therapies is excitotoxicity, neural injury that results from the presence of excessive glutamate in the brain. Glutamate is used as a neurotransmitter to mediate most excitatory synaptic transmission in the mammalian brain. The presence of excessive amounts of glutamate can lead to excitotoxic cell death. Let me ignore the warning on this. Alrighty. Who's here? Hello. Fuck it, I'm gonna be in my VC because I'm bored. I'm gonna be in like my voice chat. Because why the fuck not? Okay. What were they saying? Glutamate. Glutamate, yes. Who is here? Hey, hi, how are you? Hi, cows.
Hi.
Hi, hey, hi, how are you? What's up?
Hey, hi.
Okay, 1 minute. I have to look for your Vieto. Where's your fucking... I have to look for... Cookie! Hey, welcome in. Hey, how are you doing? Oh my god. But yeah. Bitch, how are you? Oh my god.
I'm good. Not dying, so.
Yay! Love that. I'm very happy about that. Oh my god.
I'm also very happy about that. I was so stressed. Like, damn.
Bitch, I would be too. The fuck?
Yeah. But now I'm doing my makeup.
Yay! We love that. I'm so happy for you.
Yeah. I've not gotten an email back from Celsius yet, but it also has been 1 day.
It has been 1 day. Also, I am very excited. I'm very excited for the possibility of Celsius. Like, imagine if they reply to us.
Imagine if they reply and it's something good,
right? And it isn't like, I'm sorry, we don't support VTubers. Cookie, but yeah,
I'm sorry.
But yeah, hi. Today has been treating me well. Oh right, bitch, did you know I passed most of my exams? I passed all of them.
I'm so proud of you.
I'm so happy. I was so tired. Like,
dude, that's so real.
Yeah, I mean, you were there. You like were on voice chat with me like one of those times when I was like literally studying and cleaning because later today I'm gonna hang out with a friend, as you know.
Oh my goodness! Yeah, yes, you do that.
Yeah.
Oh, you do hang out with your friends.
Yeah, I know. I also got to eat jjajangmyeon.
Hi, Chris.
But yeah, hi, Chris.
I love jjajangmyeon.
I love jjajangmyeon too. I got to eat that and some dumplings like after the exam session, and it was great. 10 out of 10.
Yeah. Oh my god, I love that for you.
That.
I might do that for my birthday. Get jjajangmyeon.
You should do that. Gas station pizza.
Yeah.
Ooh. I've never actually eaten a lot of gas station pizza. I like Buc-ee's. Gas
station food scares me. I'm gonna be so for real.
No, that's real. I only eat Buc-ee's. Buc-ee's I trust.
I've never been to a Buc-ee's.
When I was in the South, I would go to Buc-ee's a lot because like we would go like out on road trips to like medical conferences. A lot of them happened in like Houston and stuff. Or Houston.
That makes sense.
So like
that just feels right.
So we go to a Buc-ee's and I'd be like, "What's a Buc-ee's?" And they're like, "Well, we're gonna go to Buc-ee's and find out." Buc-ee's had a lot of food. Food was pretty good. Pop.
Oh, okay. So finish my makeup.
Also, girl, I'm so excited. The customizable model that I'm using, there's gonna be an update to it soon. There's gonna be pants. I won't have to have my fucking booty shorts on, basically.
Oh my god, I love that for you.
So I'm kind of sad about it too because like then y'all won't be able to see the fucking bone work that I put in.
I mean, I like how those aren't even booty shorts. Those are very much like high-waisted mid-thigh.
They are high-waisted mid-thigh. I'm glad, but like they're not pants. I like pants. I'm a tiny shirt, big pants person, as you know.
As I do know that.
Yes, you do know that.
I was gonna say.
Yeah, you know.
Booty shorts are what my model wears.
I know.
Those are booty shorts.
Yeah, those are booty shorts.
You're like, that is true.
I do not have. I'm gonna be so for real. The bones would be popping out in booty shorts.
The bones
would be peeking out. So no. You could probably see like my entire sacrum if this model wore booty shorts. I'm gonna be so for real.
Honestly, it could work though because like for medical reasons, be like, hey guys, Hey guys, what bone is this?
What fucking bone is this?
What bone is this? Kind of like it's a game show.
It is. It could be. Oh my god, wait.
It could be.
Wait, oh my god, I just had a terrible idea. You know why?
What? What?
Technically, I don't have
Technically.
any parts.
Right, we know.
I could. You guys could
No.
identify the fucking. You guys could identify my fucking. What's it called? My whole
What bone
thing.
is this?
My whole spine. And yes, we are gonna do Q-Bank, actually. We're gonna open up past medicine. I just have to like transition over to that scene really quick.
Mm.
Where is Kels? Where did I put you? I think I lost you.
Where'd you put me?
I don't
I'm
know.
gone.
I know. I'm like, where did you go? At least I can get rid of that now. I can open this.
I got banned from stream.
No, you didn't get banned from stream. I'm gonna put you back in a moment.
Okay.
I just have to like fix this window really quick. That way I don't accidentally like show everything, you know?
Oh, yeah.
Yeah.
That's my black screen is what that's for when I play Genshin.
Fair, 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 fair. There's a group.
Trying to figure out.
There we go. There you are.
Color? Early sunset? Yeah, we'll do early sunsets today.
I'll put you on my head.
Oh my god, I'm your little hat.
Yes.
Hey guys.
We're gonna do Q-Bank. We're gonna do medicine today.
Oh.
I mean, I am a med student. Like, this...
Wait, you are?
Yeah. That's my whole thing.
I wouldn't have known that. It's not like you've ever said it.
I know. It's really not like I've ever said it, ever.
Ever.
I know. Just do a random Q-Bank.
I'm still thinking.
I don't know, like...
Is Q-Bank just like,
just random questions?
Fucking... I was gonna say, is it like the flashcard site, Quizlet?
No. Q-Bank is just question bank. It's just a short abbreviated version of the word question bank.
Oh, okay.
There we go. Here it is. Let's just do like all.
Low
I
key.
haven't done any renal. I should do some.
You should.
All right, Boba. Have a good day. Yeah,
Bye,
I don't know
Boba.
what Q-Bank to do. I just want Q-Bank. What the fuck? Just give me a Q-Bank. Just start the questions.
This is the gloss I wanted.
Here we go. I did it. I did it. It's set up. It's set up.
Oh, I'm so proud of you. I'm so proud. Guys, everyone clap for Spec. He did very good.
I know, I really did. But okay. So, 24-year-old woman presents to the GP complaining of having difficulty at work. Over the last month, she'd been experiencing painful episodes of painful fingers on both hands which turn white and red. She works as a gardener and requires a high level of dexterity for her role. The episodes resolve after she finishes her shift. I am pretty sure this is just exaggerated basic constriction. Yeah.
I was gonna say, is this not because of her job?
This is Rayno phenomena. Rayno phenomena is just excessive like constriction of your blood vessels in the blood vessels in your hands.
I will pretend I know what that means.
I just told you what that means.
You still used big words that I don't know what they mean.
I know it's called vasospasm hema, but also I have a lot of lay people in my chat now. I have to actually explain what these words mean. Basically, it's just temporary constriction of your blood vessels. That's it.
Ah.
Yeah. Hence vasospasm. Yeah, so the patient likely has Raynaud's disease, Raynaud's phenomena, or Raynaud's disease, which is a condition characterized by vasoconstriction of the digital and cutaneous arteries in response to the cold. Digital as in hands.
That makes sense.
Yeah. This is more likely to be Raynaud's disease, which is primary rather than phenomena, which is secondary to another disease, as the patient is 24. No, I mean, no, turning red was valid. They turn, because, like, remember what happened? Like, they turn white. Then when because circulation and shit comes back, then they turn red, and then they turn painful. What? Turning blue is a classic thing? Really? I thought they turned white. That's what they told us.
Don't worry. I mean, it could be that weird like skin color blue where it does look kind of white.
Pretty sure if you remember from step 1. I mean, you passed step 1. I haven't yet. Oh yeah, no. Yeah, the classic is like vasospasm, white, then like bluish, and then hyperperfusion. Yeah. But like, I have seen it turn like just straight up white to red. So, white to red plus pain. So, it's not like out of the ordinary. In a way. Okay. Let's see what this is. Ooh, AKI, ooh. Shit. 70 kilogram, 55-year-old male is recovering from a community-acquired pneumonia in the hospital. Had some blood tests. Okay. So, salt is a little low. Sodium is okay. Bicarb is okay. Urea is almost high. His creatinine is like off the charts though. This is like AKI stage 2. What's urinotoxic? Oh yeah, diclofenac. Thank you. I was like, the NSAID. Yeah. NSAID should be stopped in AKI as they may worsen renal function. Did you know that ibuprofen is an NSAID? Or a non-steroidal anti-inflammatory drug, Kels?
I did not.
Now you know.
That is not in my common knowledge, but now I do.
I'm glad that you now know.
Thank you.
Of course.
If I'm like, shit, I need an anti-inflammatory something, whatever you just said.
You can just...
I'll be like, shit. And I'll be like, Spec taught me. Yeah. Ibuprofen.
Yeah. You be what?
Who up all night profin their IB?
Shit. You don't know this? Wait, what do you mean you don't know this, Hema? Which of the following changes?
I know the Hema.
I know.
Who doesn't know a Hema? What?
One of my, like, also some lore. Hematopoiesis. He has been one of my day ones from before I was an affiliate and before. Like,
hi Hema. I thought you were saying like hemoglobin, like blood.
No, this is which of the following changes are not typically seen in established dehydration? So I mean, hematocrit.
Oh, I can tell you that.
What?
I'm dehydrated as fuck all the time.
Oh,
what are the answers? What are the options?
What is not seen? So, rising hematocrit, urinary sodium.
I don't know what these words mean. Never mind.
Metabolic acidosis, decreased serum urea to creatinine ratio, and hypernatremia. What is not
I was
seen?
so confident, and then you said a bunch of words I've never heard before in my life.
I feel like, hear me out, Hema. Hematopoiesis. Wouldn't the urea to creatinine ratio be increased? So that's an obvious no. Hematocrit potentially. Hematocrit could potentially be it. What do we think? Oh my god, wait, hey, hi, how are you?
Hi.
Oh my god, Maddie!
What just happened?
You're a dirty hoe.
Why am I a dirty hoe? What have I done?
You exist.
Well, fuck you too.
I know!
Oh my god. Same city friend.
Yeah.
No.
Yeah. The stupid burbs. I'm just on my lunch break. I'm bored.
Okay, fair enough.
Don't worry. I'm like 2 blocks from the burbs, so.
Oh my god.
I'm like, I'm almost out of the burbs. I'm so fucking far.
That's real. I was gonna say I'm only in the city on a technicality.
Spec was almost born in the city.
I know. He told me.
Yeah, I told him. I told her. And yeah. But also, wait a moment. I have to say some curse shit. 2 seconds.
Okay.
Oh god. Ara. Grapes? I don't know why that's a thing. Yeah.
Grapes?
Yeah, but also, Hema, do you see what I mean? The creatinine concentration would stay the same, but the solute concentration will go up. Because there's less water for it to be dissolved in. Less solvent to have the solute in there. So, like, by that technicality, it would be increased. Would we not? Would you agree?
What is this about?
I'm doing Q.
Medical stuff.
I'm doing Q. Meg, do you want to see?
Do I don't know. I have your stream up so that I can give you lurky lurk points, but like,
Yeah.
my answer is 17.
I was right.
I was so excited and ready because it was like symptoms of dehydration. And I was like, oh, I know this shit. I'm always dehydrated. And then Spec said words I've never heard.
I'm sorry. This is normal.
And I was like, oh, maybe I don't know.
That's how I felt yesterday when my freaking mother asked me. She's like, "Do I have gout?"
Wait. Why was she wondering about gout?
Because my mother hasn't seen a doctor, potentially, you know, I was probably in middle school.
Icon.
And, you know, she's like 63. So.
She just headcanon herself having gout.
She's been having like joint pain.
Okay.
In like every joint. And like
RNA spliced into
psoriatic arthritis runs in our family, so she's just kind of brushed it off as that. But yesterday, like her ankle and foot started swelling, and she's like, "I think I have gout." And she was like, "Nurse Maddie, do I have gout?" And I was like, "I haven't even started school yet."
Okay, I was going to say the only info I know about gout is from watching Everybody Hates Chris as a child.
I can tell you about gout if you want me to. Do you want me to tell you about gout?
Sure.
Yeah.
Sure, Dr. Speck.
Yeah. Gout is basically this kind of a hyper-inflammatory thing. Number one, and it's because of an increase. It's either decreased secretion of uric acid, which is what gout is. It's just the increase. It's like the accumulation of monosodium urate crystals in your joints. It's either a decreased secretion or increased production. That's why a lot of medications can like fuck with the production and with the fuck with the production or fuck with the excretion. Yeah. Hyperuricemia usually is increased production. Yes, but we had to learn about like the other one where it's like decreased secretion as well. So that's like a different thing. It's usually one-sided. Fair enough. Thank you, Hema. But yeah, so basically it's just, I was about to get to that. It like will classically show as a tophus, right? No. Tophus is like the mass that's in your joints, while pannus is the tophi. Wait, is it tophi? What is the thing? There's a specific name for the one that's in your foot. Is it still tophus? Pannus is alright. Fuck. Okay. I got them confused. Sorry. But yeah, so basically, gout is just big production of uric acid, and then big production of uric acid with teeny tiny secretion of uric acid, which means it'll just accumulate in your joints. Usually starts in your toe.
I knew it was in the toes.
Yeah. Wait, but I've also seen it in like wrists too.
So this was just her ankle. So she's like convinced she has like, and I was like, I don't know what the fuck. No, she would sooner
talk to a VTuber doctor than a doctor.
No. I mean, like she would probably. I have been trying to convince her for probably almost 5 years that she needs to go see my foot doctor to get her heels professionally, like actually like sheared down with a scalpel.
Wow.
Because she has these huge, I can't even call them cracks, because crack would imply that it's like dead skin.
I know what you're talking about. Like they're
crazy. But like they bleed. They bleed.
Oh.
Right. Like they're that deep. That's why I'm saying I don't want to call it a crack. It's literally an open fucking wound. And I'm like, you need to go.
Yes, I appreciate.
See him. She's just like, I'm fat, and I'm like, that's most of us in America. You're not special. And I said, they know how to handle like fat people. But between the fear of it hurting, her distrust of doctors, and the fact that she's obese, she won't go. So, like, all I'm saying is that my mom probably won't see a doctor again until she's dead.
Oh.
Like, and someone is literally like, what killed this bitch? And I'm like, stupidity. Can you put that down as the cause of death? Stubbornness.
Hi, Lemon. Welcome in.
Hello.
We're doing some cubing today. And yeah, your mother is concerning to me.
Yeah.
She's concerning to me too. She knows she could go get medical care and she just like chooses not to. And I'm just like, okay, live that truth, I guess. I had to convince her yesterday because her hands and her like wrists were hurting so bad. I had to convince her to take some Motrin.
What? Okay.
Oh.
I was like, why don't you like take some Motrin? And she's like, I don't know why. She's like, my mom's the kind of like Midwestern lady who's like, I don't know. I have all this drawer of hundreds of dollars of all natural quote unquote supplements.
Oh.
And I would rather take these supplements. Like she chugs apple cider vinegar when she has heartburn.
What?
And she's like, or baking soda or some shit. I can't remember what she chugs, but she's like, it gives me instant relief. And I'm like, that's great. It's also temporary as fuck. And how do you know how much to, I was like, I don't, she's like, you should do it. And I was like, I'm good.
No, thank you.
Not work.
I was like, I'll stick to Pepto, thank you.
Yeah.
So like, she tries to like avoid all of the pharmaceuticals.
Shiba, hey, hello, welcome in. We're doing Q-Bank. And
Q-Bank.
Also, wait.
We're yapping doing Q-Bank.
Yeah, we're yapping, we're doing Q-Bank. And you were between A and B? Okay, fair enough. I just kind of zeroed in on rheumatoid arthritis because her mom has it. But yeah, I should have thought about fibro.
But isn't fibro, how do you even diagnose fibro? Is it one of those things that like you test everything else and then you kind of end up there?
So, okay, let's look at the rationale here. This patient presented with a chronic pain described as all over her body for the past 6 months. The pain didn't appear to be originating from the joints, therefore this makes, oh, that's why I didn't see, okay, I thought there was joint involvement. Makes a diagnosis of rheumatoid arthritis or RA unlikely. The two most likely are fibro or polymyalgia rheumatica. Oh, polymyalgia has fever though and weight loss, so yeah, it would be fibro. She also feels tired and suffers from sleep disturbances, which are both common complaints in patients suffering from fibro.
Dude, I did it! I was right, it is a diagnosis of exclusion, I did it! I knew a singular thing.
Girl, you know a lot more than a singular thing. Don't fucking lie to me.
I know a lot about a little.
This is FSH.
Or a little about a lot. It's an interesting time. Oh, I have to go back to work.
Oh.
Also,
I don't want
Rico,
to.
absolutely. I'll do your stats for you. Can you pay me? Or like
he's going to a DNP program with what fucking money?
I'm joking. That's why. I'll do it for like I'll do it if he like fucking like plugs my streams whenever I do them. I obviously won't show the stats. I know. Wait. Let me see the question here. He has less energy. Wait,
okay,
oh my god, you actually would put me on. Okay, I'd be down. Okay.
Okay, you guys have fun. Bye-bye.
Okay, bye.
Bye.
Is this better? Yeah, I was thinking FSH. Mainly, I was thinking FSH here. Like, follicle stimulating hormone makes a lot of sense because of the low libido and difficulty maintaining erections. And, like, your testosterone, I do want to see what his free and, like, yeah, right. but he has less energy. Could prolactin also do that? I mean, FSH, yeah, it is an estrogen, but it's also not very different in men. What does luteinizing hormone do? Oh, wait. No. I cannot go down this rabbit hole again. I think it's luteinizing. Luteinizing. It's luteinizing hormone. It has to be luteinizing hormone because follicle stimulating is female. It has to be luteinizing. Hear me out. Let me click luteinizing. I think it's luteinizing hormone. Yeah, it's luteinizing. I was right. I remember this. I'm so glad I remember this. Fuck. God. I'm so happy. Also, Shiva, bitch, you should be answering questions too. Put in your answer in the comments of what you think it is. And then, like... What? Okay, next one. Yeah, what's up? Prolactinemia. Oh! Prolactinemia inhibits FSH and LH. That's why I was thinking maybe prolactin. That's why I was thinking prolactin. Because, like... Because also increased prolactin is going to fucking lower libido. And also lower the secretion of testosterone because of the lower of FSH and LH. That's why I was thinking that way, but they were asking for specifically. I was just thinking, like, what could have caused this symptom? So yeah, you know what? It all makes sense. It all makes sense in the end. Thank you. High ammonium level. He has a family history of a urea. Yeah, I was thinking A or C, but I don't remember which one. If it's urea cycle disorder. Huh. Because, like, B, D, and E are just wrong. But really, it's just A and C. 50-50 just guess? Yeah, I'm gonna guess on carbon oil. Yeah. Wait, what the fuck? Go back. Go back. Go back. What the hell? Where's the set of questions that I was doing? I had a whole set. I'm taking my questions. Oh my god. Damn it. I'm so sad. The question went away. Where was the set that I was already doing? I already lost it. Fine. I don't care anymore. New set. Entirely new set. Fuck it. Fuck it. Doesn't fucking work. Alright, 34-year-old man has been hit on the head and the medial side of his elbow by a cricket bat and is now in substantial elbow pain. He also reports that his little finger has gone numb. No acute fracture, but the soft tissue swelling is severe. He cannot abduct his thumb when asked to do so. What nerve has most likely been damaged? I'm not going to answer this. You're not going to answer this. We're going to have Shiba answer this. Answer. You know this. Let's try it. Ulnar. The abductor pollicis longus is innervated by the ulnar nerve. It's okay. It's okay. Hey, look. It's fine. A team of clinicians and researchers have developed a new screening test for Parkinson's disease. The test is used on 320 individuals that have been identified or as having or not having Parkinson's with the current gold standard test. I know. You know who got this one? Shiba. I'm gonna make Shiba answer this. Also, thank you guys for sticking around. Like, this isn't like this is like a callback to a lot of my older content. Shiba, come on. I already know research shit. You're the one that needs to know this. You're gonna answer it, and you're gonna answer it right. Tell me what the negative predictive value is for this test. Out of the 167 individuals who have the disease, I know. Technically, she's not gonna go on to the States unless, like, come on, Sheba. This is also on the Compre and also on the PLE. Come on, you need to know this. Also, my gecko is doing very well. He's living.
Good.
Yeah, I'm very happy. Shiba, come on. I've taught you everything that you know. I've taught you more than your fucking FCM professors. And you can't even lie about that because it is true. So I want you to try this. Yes, you can. Yes, you can. Our final in this is coming soon. You have to. Come on. Come on. We have to be able to do this. Out of the 167 individuals with the disease, so 83 tested positive and 84 tested negative. Out of the 153 who do not have the disease, 66 test positive and 87 test negative. I showed you how to make the matrix. Fine. I was trying to make her do it because, like, this is what I wanted her to do because I literally taught her how to do this in class. I literally taught her how to do this. That's why I was, like, trying to make her do it. Because she's one of my actual IRLs from, like, med school. And she doesn't really know much of how to do it. So that's why I was like, you need to know how to do this. Next question. Hot T-bone. IL-3, right? IL-3, yep, hot T-bone. What? Isn't it 3?
Oh shit.
Oh, myeloid cells. Fair enough. Proliferation of B cells. I thought it was myeloid. Fuck, because it's the bone ones, not the B cells. Rip. No, okay. Wait. Yeah, this is... Wait. Yeah, no. Yeah. Wait. I'm gonna look it up. We're gonna look at interleukin functions. So... IL-1, TH cell stimulation, NK activation. IL-2, TH1 cells, stimulate growth and differentiation of T cells. IL-3, proliferation of myeloid progenitor cells. IL-4, proliferation of B and proliferation of T. So it is 4. Yes, yeah. IL-6 has plasmablasts to differentiate the plasma cells. Initiates antibody secretion by plasma cells, it stimulates the differentiation of hematopoietic stem cells, and stimulates the differentiation of T cells. IL-7 stimulates the differentiation and proliferation of lymphoid progenitor cells, and IL-8 stimulates chemotaxis. IL-10 induces macrophages to produce cytokines, B cell activation, Th1 inhibition, and Th2 activation, and IL-12 stimulates differentiation of activated T cells into TC cells. Bode, could you clip this with what I just said, please? Like the whole thing. So that I can just save it. IL-1, yes, IL-1 is pyrexic. It also causes fever. But there is more than just the hot T-bone steak. mnemonic, as we have obviously seen here. I feel like a better mnemonic would be, I'm gonna marker. I think like a better mnemonic would be like, fever tablet means effective antipyretics action. What the fuck do I mean here? So IL-1 fever, IL-2 T cell stimulator, IL-3 marrow stimulator, IL-4 IgE, but also just B cells and T cells, IL-5 class switching to IgA, IL-6 stimulating acute phase protein production. Yeah. Yes, they did. Our professors taught about every function of the interleukins. Yeah, they did that. Okay. 81-year-old lady presents her with her GP with a past medical history of myocardial infarction. This has left significant damage to the conduction system of her heart. There is damage to part of the conduction system with the highest velocities, leading to desynchronization of the ventricles. Which part? Bundle. Is it the bundle of His? Where is the sinoatrial node? I know the SA node. Isn't the SA node the one that conducts the fastest? Like, it's the one? But yeah, I'm like tied between bundle of His or Purkinje, because like it goes from there. So I'm going to just say Purkinje. What do you mean you're cooked? Didn't you like, you're in clerkship right now, are you? You're literally doing rotations. Okay, fair enough. You haven't done basic science in a while. It's Purkinje, you were right. It was Purkinje. It was a 50-50 though, honestly. Or I do more. Episode of strange behavior. Witnessing her daughter suddenly smack lips. Ooh. This looks like temporal lobe seizure. Temporal or parietal. I forget. Wait, temporal has sensory stuff, right? Temporal has sensory stuff, right? Because this looks like a temporal seizure. Yes. Because I was like, okay. She had an olfactory and she had an olfactory. Yes. You can make an account and it's free. If you guys are interested in answering questions as well, go to pastmedicine.com, #notsponsored. Imagine if they sponsored us though. Kels, you know what we should do? We should all become like, go to medical school and then so that we can get like the medical school sponsorships. Like the medical like stuff sponsorships, because they do make money. Sketchy?
I don't think.
Sketchy makes so much money.
I don't think I'm gonna go to medical school.
You
Spec.
should. You should. I'm totally not biased
Spec,
or anything.
You underestimate my brain power. I'm dumb.
Bitch, so am I.
You're in medical school, so you are not dumb.
I'm a little dumb.
See, remember, the only difference in our font is that I'm the stupid font.
No! I don't believe that.
Like, no, I'm literally you if you weren't smart enough for med school.
Oh, fuck.
I just yawned and messed up my makeup. Goddamn.
No! But okay.
I'm playing Tomodachi Life.
You should absolutely play Tomodachi Life. Okay, a 67-year-old man.
A what?
An old man presents with clinic with, yeah, this is CHF. This is absolutely CHF. Yeah. I didn't even, I like started reading and then I saw ischemic heart disease, poorly controlled hypertension, bilateral pitting edema. Wait, what about the liver? Yeah, no, this is congestive heart failure. Yeah. Because right-sided. No. Because this is right-sided. Remember, right-sided heart failure is a congestive cause of hepatomegaly. Left-sided doesn't cause hepatomegaly. I think it does other shit. It has portal hypertension. Yeah. I really like CHF. Also, Kiva, I know that you mentioned that I shouldn't go into internal medicine, but like, I kind of like diabetology now. It's interesting. Like the pathology and like, ugh, can't believe I said pathology out loud. I hate patho as like a subject, but I like studying. I like learning and studying about diabetes. Diabetes is really fucking interesting. Man, oh, this isn't Bud Chiari. Bud Chiari does not make sense here. I know you're going to internal med. You're going to EM. I'm glad. You like emergency med. My ADHD ass could probably survive EM, but also God, oh no. I like having time to myself. Type 1 DM. Oh, Bud Chiari makes sense in the sense of hepatomegaly, but it doesn't make sense for everything else that happened, you know? I mean, here's the thing. I like the chaos in emergency medicine. What I don't like is I don't like not being able to go home. I want to go home, you know? Sheer blood test has been obtained. What is the most likely diagnosis? Oh wait, let me read this. I didn't actually look at this yet. So he is acidic. Ooh. This looks like DKA. I mean, it looks like keto acid. It looks like acidosis. I'm trying to remember if it's like fucking recipe and shit. Yeah, okay. And I get maybe. Yeah, let's see. Yep. Oh yeah. Oh, this is DKA. DKA is elevated anion gap. Metabolic acidosis. I forgot. Okay. Chest pain on exertion is diagnosed with angina. Which of the following is most likely to be seen in her arteries? Foam cells aren't going to be happening in angina, right? So it's going to be D. Wait. D. Yeah. Wait. A, B, C, D. Yes. Yeah. LDLs. Yeah, this is an atheroma. This is an atheroma formation. GP. The main effector is not. That was a free one. What the fuck? That was free as fuck. Hyoid bone. What is the level of the hyoid bone? Yes, I know. We talked about it. Just let me answer this one. Wait, where is my hyoid bone? I can literally take off my fucking model's shirt and find out. What is the level of my hyoid bone? Oh, wait. See, 1 or 2? 2, 1 minute. Yeah, it's C2. The level is at... So, oh, no, it's at the C3. It says C3. Yeah, yes, I remember this because I just palpated it. Hyoid is... I'm gonna look. Yeah, C3. The notch of the thyroid cartilage is C4. The cricoid cartilage termination is C6. Yeah, I just felt my fucking... I felt my neck for a second. I had to like literally touch it. Okay. Yeah. Pass away short for... Oh, fuck. CHF. Causative... Ooh! Wait. Giant cells are primary necrosis at the start of the heart? This looks familiar. This is... Yes. This is rheumatoid fever. Oh yeah, remember how you mentioned that I almost got that? Yeah. Remember how you mentioned that I almost got that when I was like super sick with like tonsillopharyngitis? Do you remember that? You were there for that. You told me to like actually get better antibiotics for it, and I did. Thank you, by the way. Probably could have died. Yeah, the Ashot bodies. Yeah. Though, like, I was first put on, what was it? Why did I force your cat to be a sleepy little baby? Because I have a very soothing voice. Go sleep, go sleep, go sleep. You're welcome. But yeah, no, it was really funny. I was sick for a while. Like, I was sick for like 3-ish weeks, like after I graduated first year. I couldn't move. I was in bed. I was in bed for so long, Kels. It was so funny.
I hate that for you, honestly.
I couldn't do anything. That was my life.
Med school is killing the doctors of the future.
Nah, it's okay. We want this anyway. We're masochists. It's kind of that's why it starts with an M.
Oh.
Yep. Oh my god, wait. This looks like, ooh, I like this. Weber's test, the results of which shown. Weber's lateralizes to the left ear. So left ear is fucky. Left is bone. This looks like, this could be, okay. I'm thinking acoustic neuroma. No. Air is always gonna be better than bone. No, air is always gonna be better than bone. I'm gonna do the Rin test right fucking now. I have my tuning fork. 2 seconds. Let's fucking find out. Hi Nathan. Hello. Welcome in. How are you doing? Okay, but I'm gonna do the fucking Rin test right now. It's okay. Okay. Yeah. Air to bone is normal. Air is greater than bone. Air is greater than bone. My ears are normal. I just tested them. I just did the Rin test. No. Normal finding. Air conduction is better than bone conduction. This is a normal finding. Also, Shiba knows this because I taught them this. I had to help them learn the I helped them with the physical exam, like our physical exam OSCE for ENT, and I did so fucking great on that. The precept even said that. Yes, that's why I'm thinking obstruction. You see what I mean? I'm thinking neuroma. It could be otitis media with effusion, or it could be neuroma. Everything has obstruction. I think either of these two have it. So I'm down to 50-50 it. It doesn't look like temporal lobe. It's always neuroma for these. Shiba, you know about the Rin test though. Because the Rin test is the one that shows that the Rin test is like, what is better, your bone conduction or your air conduction? A normal finding will be that your air conduction is going to be better than your bone conduction. While an abnormal finding is your bone conduction is better than your air conduction because there's something blocking the airflow in. Do you see my logic here? I'll click neuroma. Okay. Hema, what did I just fucking say? I was gonna click otitis media, then you said, this is my point. This is my point. I should have clicked a fucking effusion. I should have clicked effusion. I should have done that. What is the logic for neuroma being wrong? Sensory neural hearing loss. That's why. Yeah, I believed you, Shiba. I also was like, he always, then Hema was like, nah, it's always neuroma for these. So I was like, okay, I'll go against my own clinical judgment and click neuroma and look at what happens. The only one that had conduction hearing, neuroma is a mass, yes, but it doesn't. It wouldn't block the ear canal though. It grows on a nerve in your head, but it doesn't like. It's past your TM. It's past your tympanic membrane, so that's not gonna be the problem here. It's like the acoustic neuroma is like after. It's like facial nerve type shit. It's like later. It's like deeper into your ear canal, like after you already have the air. This is what acoustic neuroma looks like. This is acoustic neuroma. Yeah. I should have followed my gut here. We should have followed our guts. Yeah, here's an... Yeah, I was trying to remember if acoustic neuroma was before the ear canal or after the ear canal. Because if it was before the ear canal, yeah, it would make sense that it would be conductive hearing loss. But it's after. It's after the ear canal. It's like deep in. Yes! It fucks with the nerve. It grows on the nerve. It grows on the nerve. Neuroma. Nerve tumor. Neuroma. Ooh. I woke over this minute and heard the bell ding ringing. Despite this, she's able to speak fluently. She has a lesion in her brain. Which area of the brain is most likely to be affected? This is, Wernicke. Not Broca, it's Wernicke. Wernicke is still temporal. Yes. Yay! Look at us. Look at us, Shiva. We're doing so good. Why don't we get questions like these in our exams? What the fuck? Why don't they give us shit like this? I would have liked this. We're doing well on this. A laparoscopic cholecystectomy. A CKK. You remember this, Shibs? During her pre-op assessment, it is noted that she's receiving furosemide for the treatment of hypertension. What is a site of action for this diuretic? Give Shiba a second to answer. We are the ones that are still in basic science. You are past it. But yes, it is the ascending loop of Henle. Wait. Well, it's in the loop. So... yeah, it's in the thick ascending. Yeah, it is ascending. It is ascending. It's Lasix. L-A. Loop ascending. That's how I remember it now. That's why I like the name Lasix more than anything else. Okay. A 54-year-old man comes to see his GP with numbness and tingling in his thumb, index, middle, and index fingers. Which, by the way, I noticed this, like, earlier today. After my exam, yes, it's okay, but median nerve. Yeah, but also, after my exam, I was feeling pain in, like, my two, like, metacarpals, my like, the metacarpals and, like, my pink and, like, my right hand on the pinky and, like, ring finger. And I'm like, do I have something? I'm thinking I hope not, because that's gonna be a lot of pain for me to deal with. That's ulnar nerve, right? Like, if I had that. But yeah, this is median. Easy median nerve. This is carpal tunnel. But, like, I have had, like, pain. Like, intermittent pain. In, like, it's not like an, I don't do the clumkey, I don't do, like, the claw hand or, like, the papal sign or anything like that. It just hurts a little. A lot. A little bit, a lot of the time. And I'm like, what the fuck do I do? Should I? What do I do about that?
Spec, do you think you should go to the doctor?
I already am gonna be a doctor. I'm fine.
Okay.
Let's see what Maddie typed. Maddie, how can I help? Caller, I need your phone number. Me? Okay, what do you need it for? What? Me, who wants call centers, contact, director of the rehab center, and what do they need it for? No. Well, without knowing what they need, I can't make sure that I'm giving you the right information. They need it. Why don't they give you clear answers?
That is just customer service, honestly.
Yes, it is. But I want I want clear answers. I want clear questions.
At my job, someone will call and they'll be like, I looked all over the website and I can't figure out how to book a reservation. And I'm like, oh, did you click the book now button? And then they'll be like, no. And I'm like, girl, why the fuck not?
Also, Socks, I can't become a robot because I'm a ghost.
Or people at my job will get mad and they'll call in and be really pissy and be like, you don't have your prices listed anywhere online. And I'm like, well, if you click on the experience and pricing tab, that's where. And then I had someone complain that we didn't have our prices online, but then told us that they never looked at the website. And I was like, what does that mean?
Oh yeah, no, this looks like the carotid, but like which carotid? And honestly, yeah, Kels, I just like getting clear answers, honestly. Maybe that's just the autism.
It's like the amount of people who I'm either much more autistic than I realized, or people are raw dogging life on a new level.
Oh wait.
Because the amount of people.
Oh no, I didn't read the answer that I clicked.
Oh, and you got it wrong?
I got it wrong. Because I was like, no. I'm going to click the carotid artery. So I clicked the first one that I saw that had the carotid artery.
But it wasn't the right carotid artery one?
It wasn't the right one. It wasn't the right one. I was looking for the internal. I'm so sad. What can I do?
But yeah, the amount of people who will like not research anything about my job in advance and then get mad when it's like parking's bad or something like that. And I'm like, it says in the email we send you. Also, I'm insane. I would know that in advance. It's crazy you don't.
Let me see what this says. 5-year-old young boys brought to the immunology clinic due to a history of recurrent severe viral infections and 3 episodes of pneumonia. Chain testing reveals the mutation that inhibits the development. Yeah, and
no, same, Maddie.
I agree with you. I really agree here. Okay.
No, Maddie, you're right for that. Like, if they said, "Hey, I don't understand because our website gets really funky, especially on phones," and so if they were just like, "Hey, I'm a little confused by the website," like, I don't know what's going on. Can you help me? I'd be like, yeah, for sure. But it's always, you don't have this. I'm like, well, it's right here.
It's on the website. You can just do it and you can just find out. Yeah, so basically, Hema, I was trying to make it so that because it was either have an hour and then 3 minutes ads, or like 30-second ads or 90-second ads like every fucking 30 minutes. I can't really do anything about that. So, yeah. Like, unfortunately.
Yeah. Yeah, if you don't have the ads at a certain amount of time, you don't get a payout, which is annoying.
That's the problem, because it's like, here's the thing. I would do this even if I didn't have a payout, but the payout definitely helps with a lot of things that I do. So it's like, I kind of want it, you know?
Or it's like not as much or something.
Yeah, it's like 30%, like instead of 50, when like you still put in a lot of work to do this shit. So it's like, yeah, it's kind of annoying. One moment. What if I like remove the chat from the thing? Because it is kind of hard to read. Because like this is a text heavy stream. Give me a second.
Yeah.
Sorry, y'all. No chat scroll right now. But there will still be emo drops.
It sounded like you said emo drops. I'm like, what'd I do?
Also, wait, Shibs. Oh, okay, you're gonna go head out? Okay, cool. I need to work on that as well, actually. So, like...
Kimmy! Hi, Kimmy.
Hi, Kimmy.
How's
How are you
too?
doing? And yes, I think it is Arcuate. I think it's Arcuate. Oh, what? No. Broca was inferior frontal gyrus. Shit. Well, also, hi. Hi, how are you doing? Relative risk. This looks like what? 58%? Yeah, 58%. Relative risk is... Okay, wait. Because it... Oh. So the reason why is because of the inferior frontal gyrus. The Broca's area is in the inferior frontal gyrus. Conduction aphasia is arcuate. Yeah. Yeah. I mean, look at this. This is not fluent. It literally says it's non-fluent and halting. Yeah. I didn't read the question, so I just went with you. So that's on me. Yeah, this is 0.58. Yeah, I was just kind of I was like kind of looking at the cuz like 84 and 120, that relative risk is like 0.5 something. You're a final year medical student observing a morning colonoscopy list in the hospital. You see patients have been both referred to for imaging due to specific symptoms, such as rectal blood loss, and patients have had routine annual colonoscopies. You know the majority of colorectal cancer is sporadic with no defined genetic predisposition in the patients, but there are also genetic mutations which if present in family history, which means that the patient will be screened via colonoscopy for the development of colorectal cancer. What are the genes? I forgot that all. I think FAP is one of them, but I don't remember for sure. Yes, that is a gene named that. I'm not even joking. FAP is one, yes. The genes of colon cancer. Fuck. It's like APC, AFP, or FAP, Lynch syndrome? Lynch syndrome, right? Is it this? It's this one. It's this one. So FAP, CRAS, but not the gene. Fair enough. I mean, they're asking for just the examples of such genetic mutation. I don't know if they're asking for the gene or like just an example. This is my question. I mean, Putz-Jeghers is STK11. PTEN is Cowden syndrome. Fucking MLH1, 2, 6, and PMS2 and EPCAM are also. That's in Lynch syndrome. BRCA, no. I don't think BRCA has it. Is CRAS hereditary? Or is CRAS not hereditary? If it's not her sporadic, then it's not that. Okay, then it could just be these two. It could be FAP and HNPCC. Yeah, it's C. Yeah. Yeah, because I was like, I know it's FAP. And I know it's HNPCC. Oh, by the way. You can absolutely buy a vowel, Mr. Manager. It's not gonna help here. Also, Blockhead, hey, hello, welcome in. We're studying. We're just doing some casual, like, QBank questions before I, like, work on other stuff. because after like probably, I think I'm down to do 30 questions today, so that then, because I still have to do like some Q&A stuff, writing some Q&A stuff for research. Okay, dyspepsia. Man's got H. pylori. Duodenal ulcer is present in the first part of the duodenum. Duodenal biopsies are taken to demonstrate epithelium that resembles cells of the gastric antrum. Oh, wait! Oh, I know this! Fuck. Metaplasia, yeah. Let me answer it first. I was like looking for the answer in here because I was like, this is metaplasia. So, yeah. Lateral posterior aspect of the right arm, particularly the olecranon process, is able to extend his elbow joint. You got so caught up with NASCAR? That's okay. Hi, Fickle. How are you doing? We're doing some just medical questions. And yeah, we're doing triceps. Yeah, this is triceps. This is absolutely triceps. Oh yeah, Blockhead, did you know? Did you know about the cursed emote that I have now? Here you go. Here you go. Here's the worst emote ever. And I'm glad the race was really good. I'm glad you had fun. Yeah, this is the triceps. I would cry if my triceps like got hurt. Because I like my triceps a lot, actually. But also, Kels, you know what I'm so sad by?
Why? Why are you sad?
All of my arm muscles like atrophied because I haven't been working on them.
Well,
like, I had
maybe you should.
Delts, dude. They were capped.
Well,
I was so sad.
Have you considered working out?
I would love to. I just don't have time anymore. And yes, digoxin.
All right, med student.
Yeah, digoxin improves inotropy. Can you scroll down? Yeah, fair. Here. It's probably D. Fair enough. Bratty sibling 6-7s at you while ranting about the assassination of Julius Caesar. Why did you have to remind me of that? Yes. Yeah, it's D. It's D. I was like reading through, and yeah, D slows your ABN conduction and increasing contractility. Oh my god. Fuck. Okay. Thank you, Kimmy, for contributing 2,000 points total to the stream in the Voice of Chat's Choice Challenge. Now I'm scared what voices you're gonna choose.
Oh shit.
Oh god, why did I remind you? No, wait.
Thank you.
No! Okay.
Oh, I can only do 2,000 per stream. Okay.
Wait, you can only... What? Seriously?
Yeah, you have it set for max of 2,000 per stream.
Oh, I didn't know that. You know what? Fuck it. I'm gonna change that because that's not fair. How do I edit it? What the fuck? Oh, I can't edit it? Oh, this is so stupid. Okay. I can't edit it. I'm so sad. But okay. Joint pain and nail ridging? Yes, this looks like psoriasis. No, I agree.
I just want you to know.
Yes?
Me and Bones Me's are currently doing intense ballet while one of my friends is posing intensely near us.
Oh,
amazing.
My God. This is amazing.
Yeah, Bone and I are having a ballet off right now.
That's holy shit. You should take screenshots or like take pictures of it like with your phone.
I'm screenshotting it. Oh, we stopped. Okay. But I got one picture of us having our ballet. And then they just wave goodbye and leave. That was all.
That's amazing.
I love the silly game. Okay, Kimmy, hear me out.
23-year-old.
Instead of doing...
This is meningitis.
Kimmy, hear me out.
Yeah.
Alan trying to do the Deku voice. That's all.
She's 23.
That's all I want to say.
Yeah, I'm thinking... I was like strep pneumoniae. So like the serial meningitis doesn't make sense. None of these make sense. Strep does. Did you know that strep pneumo is the most common cause of meningitis in adults? Did you know that, Kels?
I did not know that.
How you know?
Did you know Vanny wants to have a baby?
He should.
He should, but he wants to have a baby with me in my game.
Oh my god. Did you make me in your game?
Oh shit, I need to. I'll do that.
Yay!
I can't draw bones though.
That's okay. You don't have to. It's really hard to draw the bones. There's no way to draw the rest of the body, so it's fine.
You can do it as clothes. I've seen people do.
I don't want to do that. I'm gonna be so for real.
No, I don't either. Should I give Vanya a karate game or a karate movie?
Yes, you should. And also, also Blockhead, that's evil. Why would you tell me to do that? Why would you tell me this? And yes, this is some opposition. This is a branch of Ulnar. Wait. Yes. Wait.
TikTok Deku? No, I still think Alan trying to do the Deku voice. Like, put them both together.
I just don't even know how to do that. I'm gonna be so for real. Let me. Okay, wait. Hema, let me like move my thumb around. Adduct. Wait. This could be superficial branch of ulnar nerve. Could be this. Oh, it's deep branch of ulnar nerve. We were right that it's ulnar nerve. I was like, I had the 50-50 of my head. Cervical branch of the facial? Cervical branch. Not masseter, not sterno, platysma, no. I could always cancel the goal and like set it up again because I didn't know it was set like that. That's so stupid. I don't like it. Here you go. I'll delete and refund it.
Okay. My IRL or like, yeah, one of my friends just told me that my me looks like Robert Pattinson.
That is amazing.
And now we're friends in the game.
Wait, how do you set the limit?
I don't know.
There's no way to set the limit. There's literally no way to set a limit. And yeah, muscles of mastication is trigem. Yes. This could be platysma then. There is no way to set the chance. Oh well, rip. That's fine. I'll start it again. Here you go. There's no way to fix it. Sorry. Yeah, platysma. I fixed the goal. If you want to, like, add more points to it, you can. I didn't know it was set to, like, 2k. I'm so sorry, y'all. That's on me.
Wait, let me see. It's still saying max 2k per stream.
I know, I gave up.
Oh.
It wouldn't let me change it. It wouldn't let me change the max that you could do. And for this,
crazy.
Scrub in and assessed bony bankrupt lesion is.
Why does it say I never did it? That's weird. Oh.
Yeah, it just won't let me. I don't know this either. I don't remember this anymore. Wait, coracoid process.
What food does she like? I'm gonna give her a strawberry.
Pec minor, coracobrachialis, and short heads of brachii. So, long head. It's the long head. No, it's a long head. Because short head. Because it's pectoralis minor, coracobrachialis, and the short head. The long head does not attach to the coracobrachialis. Or, the long head does not attach to the coracoid process. Yeah. So it's A, B, D, and E that all attach. The biceps brachii attaches at the fucking supraglenotubercle. Then its tendon passes through the shoulder joint and then down the humerus, or meaning the belly of the muscle. So it's not that one. Ugh. It's not that one. Okay. Condition that runs in her family. Which of the following will be the uncomplicated delivery? What condition would this be? Uncomplicated delivery. She could enter her family. Oh, consanguinity. Wait. Oh, right, that same blood. Same blood. Yeah, no, she's inbred. ALS, right? Wait, no. Would it be triploidy? Triploidy? Would that be it? I don't know. I don't know about this. Oh, CF? Maybe. Okay. I'll click it. Oh, CF. Fair. Okay. ALS is sporadic. Less likely to be inherited than CF, which is heavily grounded in inheritance. Okay, cool. Triploidy. Oh no, I'm just stupid. Okay. Rare genetic condition containing 3 copies of gene sent to. Okay, yeah, I just fucked that up. I forgot what that meant. Seemed healthy. Ooh. Darkened model. This is immediate. Is like the immediate host thing, host thing, and I forgot. Do you remember the name? Because I forgot. B cells? Okay. Yeah, B cells B cells mediate hyperacute. Okay. Thank you. Also, to all of those that are contributing to the points thingy, I really appreciate it. You get to torture me. Also, by the way, if you already did and then it didn't work because I deleted it, you can recontribute because I fucked up. That's on me. You can add more points to the thingy, please.
I did, and it didn't register my points.
It didn't register it?
No.
Wait, but like there were 2... Because I deleted the other one. You should be allowed to do it again.
No, I know. I did it again, but it didn't say that it did, and it didn't take them from me either.
It didn't take them from you? What the fuck?
No.
Oh. Ancestry Bravo is a planet. This was a chronic, so maybe T helper. I agree with you. That makes sense. Oh, B cells still? Is it still B cells? Oh. But it didn't even mention like how it got rejected. That's
pretty much.
That's so stupid. That's strange. Yeah, that's so weird. That's a weird fucking question. Oh, Drew's in a new vessel formation around the macula. Car accident. Oh, VEGF. Monoclonal antibody has this mechanism of action. Fuck. God, I don't remember this anymore. Oh my god, I'm so rusty. I'm so rusty at this stuff, y'all. Yeah. VEGF. Wait. Is it bevacizumab? I think it's bevacizumab. Yeah, rituximab is a no, but beva maybe. Do you want me to send it? I'm down to send it. Does it make sense to us? Yeah. Yeah. Oh, yeah. Yeah. What age-related macular... okay. Fair enough. Yeah, abscizumab is platelets. Adalimumab is tumor necrosis factor for inflammatory arthritis. Omalizumab is asthma. I know that one. We had a patient that was like trying to get that approved, and it finally happened after like a year. And then rituximab, yeah, obviously no. Rituximab is for lymphoma.
That is a cookie.
A cookie?
Oh, I'm playing Pixel Quiz.
Oh, okay. Hell yeah.
Sorry.
No, it's
I
okay.
forgot.
It's okay.
I
It's
keep
fine.
forgetting I'm on call.
No, it's okay. It's okay. I just want to see what you're up to.
I'm playing Pixel Quiz.
Hi, Vanny. Welcome
Ceviche.
in.
Oh my god, Vanny. Hi, Vanny.
Hello. This is a gorilla stream, unscheduled. We're just here. We're just yapping. I'm doing QBank before I have to go do some like Q&A question, write some Q&A questions. Yeah, this is Corporal Manale. I am tired, but I passed my exam, so you know what? Could be worse.
I'm playing Tomodachi Life right now, Vanny, and then I have to go leave in like 30 to go to work. But I'll stay on call because I have to walk to the train.
Yay! I'm so happy. I'm glad that you're staying. Yeah, one moment. I'll look. Here's all of them.
Oh, I got a ghost. I'm gonna save the ghost for when I make new spec. Have a good day at work. Thank you, Vanny. It's supposed to be my day off, but there's like an event, so I have to go because I'm in charge of the events.
Ew, God.
Oh my god.
But yeah.
Why is there a bunch of eagles with syrup?
You're dreaming apparently? Yeah, I don't know the answer to this. I'm just gonna do D. And why not? Oh, it's smooth and patomegaly? Oh, is this fucking right heart failure? Oh, Rel, hey, welcome in. I know, I was guessing. I literally, I literally said that I may have a tentative stream today because there's not much happening tomorrow. I literally posted it in the announcements on my server. You're a part of that server. You could have saw. You could have read it. It was right there.
Ralph was just like, "What the fuck?"
It was
that
right
was not
there.
Supposed to be here either.
That was before you were asleep. That was before.
Oh, Vanny's distressed.
Why is Vanny distressed?
Because he thinks he's being watched.
Oh, well, yeah, by you.
Oh, you're welcome, Vanny. I hope you slept well. Also, if you talk to Sucho, tell him I'm sorry I kept being so mean to him by accident.
Did I announce it loud enough? I announced it. I feel like that's fine, right? I announced it. Wait, oh no, did I do the self-promo bullshit? No, I didn't do that yet. Fuck. I'm so annoyed. I
know, and Sucho was so nice to me too. I felt so bad.
What did you
do? Oh, Spec, you missed.
What did you do?
So I don't know how to read, and so Sucho would be like, "Oh, this is my favorite part," and I thought he said least favorite part, and I was like, "Yeah, this area." And then at one point, he called me a fast learner because I didn't read the tutorial and I just had to figure it out. And I thought he told me to learn fast, and I was like, "Sucho, stop being a dick."
Oh.
And then Bone was like, "He said you're learning fast," and I was like, "Oh."
Oh, yeah, no, this is definitely... Oh, wait, no. Oh, this is Tiag... Okay. Never mind. Sure is about the Clopidogrel? Well, yeah, this is Tika Seglor, or Tika Grelor or something? It's a different one. Tika Grelor, like, inhibits ADP binding to platelet receptors. So, maybe that's why... That's what they were thinking. If you have to go, that's okay.
Who has to go?
Oh, wait.
Who has to go?
Oh, I thought you said you had to go.
Oh no, I was saying who should go next on my island?
Me.
Okay.
Me. The answer will always be me.
Spec.
You should just make
it will always
spectrals.
Just only the spectrals.
an island of
I can add 61 more.
Oh my god.
Oh, do you want to be a boy or a girl base? Because I know you are a third worst thing.
I am the third best thing, and
that's true.
Honestly, the boy hair is like pretty close to my hair, so like I'll do that.
Okay.
Yeah. Hereditary rheumatoid arthritis presents the clinic isn't treated with various disease-modifying DMARDs. There's no worm base. I don't allow the worm. No.
There is no worm base. No, the worm's in yours.
I know. The worm is in my channel. The worm is in my island. Joint pain, swelling, and stiffness. T cells? Yeah, no, this is T cells. Oh, tumor necrosis factor? Yeah, yes. Which T cell, though? I should have listened to I should have like actually read the question. Did you know
That's
that milk is the fastest liquid on Earth? No, I did not. Can you explain? Yeah, it was macrophages. Damn, I also overthought it. God damn it, that's a good joke. That's a good joke. Hell yeah. Hell yeah. Amazing.
Kimmy, if you're still here, I'm sending you more witch hat stuff.
I need to do that. I need to do more like that. That'd be cool.
Spectral, you did not say hi to Nutsack, who is here in your chat.
No, I did say hi.
Oh, okay. I did not hear you say the words, hi, Nutsack.
Okay, sorry. Ah, that's what you wanted. Hello, Nut. How are you doing, buddy? I'm not saying your full name, but okay.
You don't want to say hi, Nutsack?
I don't want to say hi, Nutsack. I just want to say hi, Nut.
I mean, it's better. It could be worse. It was when Sucho was on my stream, when people would come in, he would be like, hi, I'm Sucho. I like feet.
I don't like that.
Yeah.
And I
you don't want to say hi, Nutsack is a wild thing to say. It is a crazy thing to say.
It is a crazy thing to say. And
Vanny slept like 11 hours. I hope you slept well, though, Vanny. You deserve it.
You deserve it, honestly. I'm gonna be so fucking for real. You need to
That might be for real blind. It's Nutsack. Wait, what? Is it really? Oh, shit, it is.
What?
It's not even Nutsack. Oh, my God. Anyways.
Do you wear glasses or contacts?
So I'm supposed to wear glasses.
Inshallah, one day you'll get fucking contacts
Inshallah.
or something.
No, I have glasses that I'm supposed to wear. I just don't wear them.
Why don't you wear them?
Because I don't like to.
Fair enough.
And I think it's funnier when I don't know how to read.
Fair enough. I have to wear glasses whenever I'm like studying, so like, which
yeah,
is all the time. So I always wear my glasses for that reason.
I'll wear them when I'm doing homework.
When I wear glasses, so like I'm kind of biased.
True. You mog all the time.
Yes, but they don't know that. Chat doesn't know that.
I do though. Kelly, I love you, girl, and I'm on your anti-glasses team, but you might need them. No, Vanny, even with my glasses, I don't know how to read. I will say.
Ooh, I noticed.
You underestimate my illiteracy.
And it is kind of the easiest way to speedrun vision damage. Hence why, like, I like wearing glasses. I'm also just biased.
Oh.
I'm also biased.
So, with mine, it's, those are crazy ass eyebrows, goddamn. I'm supposed to wear them when I'm on screen specifically.
Hi.
Oh my god, it's Issa. Yes, I'm supposed to wear them when I'm like... I know. I'm supposed to wear them. Geeks out. But yes, I'm supposed to wear them when I'm like on computers or doing like a lot of reading and stuff.
So every time that you're on stream?
Yes, but I'm also not supposed to like get up and walk around in them. And so like I don't wear them because especially when I like work at my job, I'll be on a computer and then getting up and then going back and then getting up. So it's like too much work to keep taking them off.
Fair enough.
I'd rather be a little blind.
You know what? Fair enough.
Yeah, because it's my eyes don't focus properly.
Oh. Great.
Yeah.
Okay, this looks like a... But not so because not kiss cake control. Oh, wait. Is this not... Okay.
What color are your model eyes, Spec?
Like weird...
Green, like greenish hazel?
Yeah, we can say that. I'll allow like a yellowish, more yellow than anything.
Okay.
Especially with,
I'm doing like a yellow green.
Perfect.
Okay, I'm doing like a yellow greeny. Because the straight yellow is kind of horrifying.
Straight yellow is funny. Straight yellow is kind of horrifying, yes. Okay, 30-year-old man sustains a stab wound to the right upper quadrant and is rushed to the OR for an exploratory laparotomy. Intraoperative findings show that the... Yeah. Retroperitoneal
Well, if you strain your eyes, won't it lead to being blind later?
Yeah.
I strain my eyes just by existing, honestly. Like, I get eye strain migraines even with my glasses on. I need to go to an eye doctor and get my prescription checked out.
You should tell your chat to, like, pay for your vision doctor.
I will. It's okay, Kelly. You don't know how to read, and I don't know how to talk. Vanny, together we are one functional person.
And then with me, we are, like, one functional person that's also a med student.
Yeah, pretty much.
Yeah. Okay, wait. The GI tract is most likely injured or stomach. So, wait, let me read through this. RUQ, intraperitoneal.
Eye doctors for Cal. I bet glasses are cute on you. Ooh.
It could be. Yes, it can. Yes, it can. Hear me out. Hear me out. It could work. Why are you calling me out? Just because I'm not a functional med student doesn't mean other people aren't also functional people and med students.
Functional person, med student can't go in the same phrase. It's true.
What do you
Plus,
mean?
like, Spec, we're the same person, so you can't be functional.
I know we're the same.
You can't be functional. Oh my god, little Spec me is so cute. Let me see if I can add your hair color to it easily.
Nutstack, yay.
Nutstack, sorry I called you Nutsack like
no,
4 times.
Funny. It was really funny. It's okay.
As you know, I don't know how to read.
Vanny, get those fucking grippers away.
Also, Vanny, I'm very excited to see the new stuff. I'm so stoked.
This is Prima Queen. This is Prom Queen.
Okay, Spec, I'm gonna send you a picture of your little guy.
You should absolutely send it to me. And yes, I agree that it's Prom Queen because it's just Plazonian buybacks. Yeah, 14-day. 28. Yeah, no, that's fine. Yeah, I was just reading through the question. I only know that it's Prom Queen or Prima Queen because of Sketchy. I love Sketchy.
Wait, Specs chat, did I tell you what we did?
Oh wait, no, you didn't. What did you do?
Okay, so you know what we did.
I want to know what you did anyway.
You were there.
I want you to tell them.
We were on. Okay.
I want you to tell them.
Okay, so Specs chat, I run on Audacity specifically. I run on Audacity, Vibes, and Spite. So,
hello, Zanza. Yes.
Hi, Zanza.
Everything is going well. You have a good day.
So yes, I run on Audacity, Vibes, and Spite. So whenever I get a whim to do something, I do it. Yes. And so yesterday, I emailed Celsius to try and get Spec and I sponsored because we love our Celsius.
I am addicted. Please send me. I don't want help. I'm exactly where I want to be. Just send me Celsius.
Yeah.
Hashtag not sponsored. Yet.
Hashtag not sponsored.
Yet.
Yet. Exactly. Yet. Hashtag almost sponsored.
Hashtag eventually. Please, one day. Please.
God. And see, I did it in a way. Oh, I just put hashtag to how to pronounce.
Obturator inguinal. Wait. Yes, it's obturator, I think. I think I'm right. Yes. That's actually pretty good. I think you just have to put a little bit more deepness in it, and then it's me. Ramipril, amlodipine, spironolactone, anxiety, medulla. Yes.
Spec, my dear, what do you want your pronouns to be?
He, please.
He.
I am a guy.
Okay, I put you as a non-binary he.
Perfect.
Have to admit, shocked but proud for the attempt. Why are you shocked? I live off of Audacity. Why is this shocking?
Let me do this.
Also, Spec, do you want the suits or the dresses?
Both.
Either is okay.
Either is okay.
Okay.
He, because I'll never be him, and by him I mean Psych and MD.
Your birthday is March what?
8.
Okay. How old do you want to be?
When my actual age of.
Okay. We're born the same year, right?
1997.
Yeah, okay.
I can do the math in my head. It's a little too low. Really enough? 34.1. This is 34.1. Yeah, go ahead. So the way to do the positive predictive value is basically positive predictive value is 100 times the prevalence times sensitivity divided by prevalence times sensitivity plus parentheses 1 minus prevalence times 1 minus specificity. Do all the math, and then the answer is 34.1. No, the bite of 87. No, this is math. That's normal math. Yeah, this is how you do, like, for those that would like to have a quick little lesson in statistics and calculating the predictive value and what a predictive value even is. The predictive value for a test is just the positive predictive value for a test is just like the prediction of like you having it. Basically, there's like 31% chance. 31%, like that's the predictive value of it, so it's good. Yeah. I kind of got carried away. I'm still doing more questions. I haven't stopped yet. I'm gonna be so for real. I love doing
Spec, I gave you a ghost.
I am so happy. Thank you so much for the ghost.
You're thinking. You're unsure if it is a good match for you. Shut up. It is a good match.
It is a good match for me. I love my ghost boy.
And I'm giving you a chocolate cake. Okay, I will BRB.
Yeah, go ahead. A 64-year-old attends a lung cancer clinic for initial review. They've been referred by the GP after experiencing a persistent cough over a period of 4 months, with associated weight loss of about a stone in 1 month. I don't know what a stone is. I'm gonna be so for real. I'm not British. They recently given up smoking, but state they used to smoke around 20 to 30 cigarettes per day. So like a pack and a half per day? 1.5 packs per, so 1.5, so 1.5, 1 minute, I have to calculate this. So 35 times 1.5 packs per day, so that 52 pack years. No evidence of asbestos exposure. This looks like a primary lesion. So this just looks like lung cancer. This just looked like lung cancer. I don't know what kind. I'm trying to remember. This could be small cell lung cancer. So, patient, old as fuck, here at the lung cancer clinic, pack years 56. What's the type of cancer it's gonna be? No evidence of asbestos exposure.
Homeboy smoking a pack and a half a day. I wonder if it's lung cancer.
Yeah, obviously it's lung cancer. I just don't know what kind of lung cancer it's gonna be.
Oh.
We can't just say like it's lung cancer, unfortunately. It'd be so easy.
Oh. My bad.
It's okay, it's fine. It usually is squamous cell, but like it didn't have squamous cell in the choices. Mesothelioma is an obvious no because there's no asbestos. If it's it's either squamous cell or adeno. Isn't like the third most common small if you or a loved one has ever been exposed to asbestos, you may be this is adenocarcinoma. Entitled to compensation.
It's true. Oh, I will BRB just for like half a second. Yeah, I need to try to call my mom because she wants to know what I want for my birthday and I need to tell her what I want.
Eye doctor.
No. Yes. Not for a birthday present. Not a birthday present.
Okay, fine. Fair enough.
Yeah. My docs are falling apart, and so I want to get a pair of Solar Bears.
Girl, we are the same person. I've been looking at a pair of Solar Bears. Like,
what color? What color are you? What color are you thinking?
I was thinking like this. Oh my god, what's the fucking? So like they're like these black, but they rub to be red. Like when they rub off, they turn red.
Yes.
I
I love those. I've been looking at those.
Oh my god. The other
the
one
super
was just
dark
like
purple or the green.
I was looking at the green also. That's the problem.
I know. I'm gonna, since they're expensive and they're gonna be a birthday present, I told my mom she can pick what color because she hates my black docs. She says they look like Herman Munster.
I like black docs though.
I do too. They're classic.
Oh fuck! I should have chosen.
Was it mesothelioma?
No, I forgot about significance testing here because like I literally have done the chi-square test. It's used to but your nominal data. Okay, fair enough. It's not parametric data. It says for independence between two categories within a contingency table. Fair enough. But still, damn, I'm cooked. I'm cooked on statistics. My old stats prof would be so disappointed with me.
Okay. Let me see if I put my hair on properly.
I'm so excited.
Oh, I did mostly. I just need to. Yeah. I'll send you a picture because I look cute as fuck today.
Oh my god. Yay. Also, Maddie, oh my god. Thank you so much for contributing points to the thing.
Oh, it finally took my points, by the way.
It finally took your points. Amazing. But yeah, to those that would like to torture me more, you can contribute 2,000 points to the Stream in a Voice of Chat's Choice challenge, where I stream in a voice of your choice for a whole stream. Y'all gonna have to like make a poll for like which voice you're doing though, because
Can we like pick a new one?
This is Con Syndrome, definitely, but sure, we can fucking pick a new one.
I want you to learn how to do like an Australian accent because I think that'd be funny.
I already know how to do an Australian accent.
Okay, but I want it to be like a shitty one.
But I already know how to do a good one. I already do a good one. Yeah, because I had to learn. You had to learn. You had to learn for a few roles. Yeah.
Oh, gotcha.
Yeah, I had to learn for a few roles. Why Lorena?
Can you do like Scottish?
No. No, I cannot do Scottish.
Guys, chat, I think we should make Spec do a Scottish voice.
GFR ACD. Oh.
I will.
Yeah, this. And yes, I mean, y'all do love me doing weird fucking voices.
It's true, we do.
It's very funny. Okay. And besides, like, if I practice doing more voices, I mean, yeah, of course I can do, yeah. I mean, I can kind of do a good New Yorker. It's not too bad, but it just
I want to hear you do like
Jersey. So it's like, I don't know.
I was going to say, I want to hear you do Jersey like bada bing Italian.
Then it just... God, I wouldn't know how to do that. I have to learn. I have to look at a lot of dialect bullshit to like figure that out. But also, if I
just watch The Sopranos, honestly.
I should watch The Sopranos.
It is good. We can watch it together sometime.
We could watch it together. I might watch it with my IRL eventually, though.
Oh, fine. Yeah. So you hate me.
No, I don't hate you. We just watch it again.
That's true. I'm already like halfway through it. I have to take breaks because it's a little too real at times.
Real.
Because it's like, do you know the premise of The Sopranos?
No, I don't. All I know was that Northern was watching it for a while and then he stopped.
It's a mobster in therapy. Okay.
Amazing.
And but then it's
a Thai impression? I don't know a Thai impression.
It's like his struggles as a mobster in therapy, and because Italians aren't big on mental health, especially mobsters. And so he has to be like, oh, I feel crazy. And then it cuts to him like murdering a man.
Oh.
And then it's like him talking to us.
Jar is crazy.
Yeah, there's a You Hate Me jar now. It's being used to fund my trip to go visit Kimmy and Blue.
Hey, let's go.
Yeah, so it's funny because Tony Soprano is like me if I was like a 50-year-old mobster.
So he's like me if I were a 50-year-old mobster and Italian.
And not a med student.
And not a med student.
Yeah, pretty much. Okay, I will BRB spec and specs chat. I have to call my mom.
Alrighty.
BRB.
But okay, yeah. So there's that. That's what's been going on. I might watch The Sopranos. I think that'd be funny. I think that'd be fun. Who knows? Maybe call and hug your mother. Maybe. And she might do that. What the fuck is wrong with my voice? Let me reset. Okay, I'm back. A 6-year-old woman is admitted to the ICU with a multi-drug resistant UTI, type 2 DM, hypertension, CVA in the past. This is a lot. Why is she on so many meds? She's on amikase and insulin and Torva. She's on a statin. She's on atenolol. She's on ramipril and clopidogrel. I don't fucking know. Hema, you're the one. Amikacin? I think that's an antibiotic. Amikacin. I think amikacin. Yeah, no, we can't get rid of that. Amikacin is it's an antibiotic it can cause kidney, nerve, and hearing problems, but should not be used in breastfeeding or kidney patients. It's used for I have to remember the class. Let me think of the class. It's an aminoglycoside. Aminoglycoside. Okay, fair enough. Wait, but she has... Okay. Oh, she has an AKI. Yeah, fuck. I didn't see that she had an AKI. I was more focused on the UTI. How can one person take so many meds at once like this? Yeah, that's the problem. That's why you take them off. That's why we have this question right here. This is the reason why we put triple whammy medicine. Okay, we're gonna look up triple whammy medicine. Avoiding the triple whammy in healthcare. The term triple whammy refers to the concurrent use of an angiotensin converting enzyme inhibitor, an ACE inhibitor, an ARB with a diuretic, and an NSAID, including COX-2 inhibitors. ACE inhibitors are ARBs and including with a diuretic, and an NSAID, including COX-2 inhibitors. ACE inhibitors or ARBs and diuretics are commonly prescribed together, either as individual medicines or as combination formulations. However, prescribers should remember that using these medications together, the double whammy could increase the risk of an AKI. Oh, that makes sense. Thanks, Hema. Thank you so much, dude. Holy shit. Therefore, care is needed whenever prescribers consider the use of an NSAID in a patient already taking the double whammy. Yeah, so obviously, in addition, we had to get rid of the ramipril. So yeah, atenolol is safe for AKI. Amikacin, yeah, okay, that makes sense. Yeah, we always get rid of okay, I get it now. I understand. Thank you. Insulin is safe. Clopidogrel is safe. Ramipril we're getting rid of, but yeah, okay, I understand. Thank you. I am bookmarking this. I'm starting that so I can read it later. See my hospital by a specialist in after complaint of hematuria, undergone a cystoscopy, and biopsy. Back normal. Epithelial cells would be seen histologically. Just simple wait. Cystoscopy, so it's in the bladder, right? A biopsy in the bladder? Wouldn't it just be transitional epithelium?
Hey, yo.
Hello. Hey, hi, how are you?
I have returned from talking to my mom.
Did she say yes to the solar bears?
No.
No!
Well, so because one, they're expensive, which valid.
Yeah.
Two, because I had been working like my paycheck was super small. I had to ask her for money
Oh, okay, fair
to,
enough.
to eat, and so she was like, no," and I was like, "I'm gonna pay you back for the money when I'm paid."
Yeah, like
So I need to go back to the drawing board.
Oh man.
Specs chat, if you want to give me Solar Bears as a birthday gift,
You should
hey,
also
yo,
give me Solar Bears as a birthday gift, excuse me. I don't care that my
that's
birthday
real,
has
except
been multiple, like, months ago. Fuck.
that's
Why
real.
are we making me do bicep curls? Fuck. Fine, I'll do more. Wait, give me a moment.
Remember when I said you should put a cooldown on it and you said, no, I want to get swole?
I know, I did. I regret that. Okay.
Remember when I said you were going to work with it?
3, 4. Wait, can you count this? Wait, how many did I do? Oh god. Why are you torturing me, guys? The bicep curls are fine. Okay, so it's 1, 2, 3, 4. That's fine. I'll just do 4 on each arm. Fuck it. 1 moment. So I don't want, because I don't want to get asymmetric. I don't want to be asymmetrical. 4. That was the right arm, and now I'm bald. Now I'm bald. 2. Okay. Honestly, they weren't even too bad. God. Fuck. The reason why is because I like doing bicep curls, and I need to get back my lost arm strength. So, god damn it, you were right, Kels.
Yeah, I was.
Shit.
Hey guys, can you clip Spectral saying I was right? Because I'm gonna save that forever. Bone, if you're here.
Hema! Wait, guys, why are you all joining in? I didn't think this was gonna be. I'm in hell. I'm in hell. I'm in hell. Okay. Okay, guys.
This is good. Keep going. Keep going.
Okay, fine. At this point, I'm gonna lose count. I'm just gonna have to go till failure. Like, I don't know how many there are at this point.
Keep going. Right. I'm gonna keep sending some too.
What?
Keep going.
Jesus. Okay, wait. I literally don't even know anymore. Okay, 55-year-old man is under investigation by the cardiologist due to increasing breathlessness, fatigue, and exertional chest pain. Echo. Thickened interventricular septum and decreased filling of the left ventricle. This looks like, go past failure?
They were right.
Jesus. God, fuck. This looks like this to me. Okay, to me, this looks like hypertrophic obstructive cardiomyopathy. Or maybe just dilated cardiomyopathy. What do we think? Why are we making me go past failure?
Because you didn't add a cooldown.
I didn't think about that. I was lazy. I mean, hypertrophic obstructive cardiomyopathy. I mean, it is a genetic thing. I mean, it could. I'm tied between the first two, really. Damn, I don't even. Girl, how many were there? How many have you read?
Vanny says he's as blind as me. Vanny, you borrowed my eyes for a second.
I don't know. I don't even know anymore how many there are. I don't even know. Okay.
You can check in. Are you on your phone to see chat?
Oh, I can.
Yeah, far left, it'll show you like all the redeems that have happened.
Oh shit!
It's like sparkles. Yeah, if you go on your stream manager on your phone.
I'm gonna go into stream manager on my phone right now. Let me open up my stream manager. How do I open up my stream manager? What the fuck?
That's a good point. Spec, where is the worm mode redeem?
Because I turned it off and I forgot how to turn it back on.
Oh.
Go B? Okay, I'll go B. I turned it off because of D&D, and then I forgot to turn it back on.
Ah.
Oh, okay, so I was right. It's hypertrophic. It is Hawk M. That's why I was saying this looks like Hawk M. Okay, wait. So, literally 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. I literally have done more. Why would you do that? How the fuck? How dare you? And yeah, 100k to end stream because I want to. What? Wait, I don't even know how to do that.
Ara. Oh my god, man.
Ara. I would not love
you
you
have
if
to be
you
the
were a
worm.
worm.
No, but you have to be the worm.
I don't have the fucking worm model on. Because I forgot.
That's so sad. Oh.
Because I forgot.
Oh, Spec.
My life is full of scuff. But hey,
thanks,
you know
Bone.
what? But also, hey, wait, I should actually send you a picture later because like I actually do have a good pump going on with my biceps, so thank you.
I was gonna say, scuffral anomaly strikes again.
Yeah, this is normal. Incomplete penetrance, yes. Wait, let me read it. Let me look. Yes, I agree.
Why is chat torturing Spec? For funsies.
Because it's fun.
Because we have a hobby and it's torturing Spec.
Yeah, that's their hobby. I thought they were here for the medicine. No, they just like making me suffer. But you know what? Hey,
yeah.
But hey, if my arms get yoked after this, thank you.
Chat, just so you know, Spec will not put you in a headlock once his arms get yoked.
Actually,
I've already asked.
I will tell all of you.
So just me you won't.
Because I respect you.
Okay, what if I said don't?
If I do that, I do it to kill. Excuse me.
Oh.
Yeah.
Okay, God forbid my dreams come true.
Okay, you know what? Fair enough. Fair, fine.
God forbid.
This looks like 30S. Wait.
Okay.
Yeah, this is tetracyclines, yes. I didn't even get to read chat. I was just like, okay, wait. God. Okay. Jesus. When the doctor puts you in the hospital, it becomes personal. Welcome to WWE. Fuck. IGG, yes. Jesus Christ.
Nicely. Okay, here's the plan. Spectral puts me in the hospital as my doctor. It becomes WWE, like Zanza said. And then Sucho joins because we know he loves wrestling.
Okay, fair enough.
Sucho's just like, wait, wrestling?
Yes, Raoul, what? What's up? Hello. What is up? 26? Jesus. Fine.
Oh my god.
And this is absolutely anticipation.
Also, I'm going to mute myself real quick because I'm walking past the some lawn mowing.
Oh, wait, no, this is expressivity? Fuck. Okay. And yes, I do remember that paper. A public health team investigates the burden of asthma in a local town. I'm just gonna keep doing this until the end of stream, I think. I think I'm just gonna keep having, like, if I'm doing the left arm right now. I'm just not gonna stop with the left arm first. Okay, Kimmy is right. Who's gonna turn the little worm into a buff worm? Fair enough.
Okay. Is Kimmy right? Yes. But we can only do 2,000 per stream. So I think that means we can do both.
Fuck. Okay, I'm gonna like do a break for like a minute. That way, like I don't go catabolic. Fuck. Oh wait, this just means I have to drink more protein. You know what? This is gonna actually be great. This is gonna be great.
Dude, Celsius needs to make a protein version for you.
I would have loved Celsius to make a protein version.
Especially since they're like all up on fitness influencers. How have they not?
No, this just means that like Chad is gonna get like not Chad at all. Celsius is just gonna have to get like B2 like I'll have to get like a head. Like a like those little like those head thingies that you can like those fur head things. but it's ahead of my VTuber model, and then the rest is just my biceps.
Oh my god.
Yes.
I think you should get a titty mouse pad, but instead of it being titties, it's your biceps.
I approve. Mr. Manager, can we get on this? The total population of the town. Let me read this. I got distracted. I'm going to the measure of disease frequency I have to calculate with this approach. This looks like a 12-month period. This looks like incidence rate. Oh, period prevalence. Okay, I was tied between period prevalence and point prevalence. So what I'm hearing is I just have to do these until the end of stream. I think.
Yes.
Okay, fair enough.
Well, expects chat to know that I just got scared by a helicopter seed because I thought it was a big bug.
Oh my god, that's real though.
Oh, the helicopter seeds are big as fuck here. They're usually tiny from where back home.
That is true. They are big in Chicago.
And so I thought it was a big ass bug.
Fuck, my arms. Okay,
I'm a little scared.
Taking a break. I'm taking a break for like a minute. Let me do like a minute break. Like
minute break of your
yeah.
Oh, 3 minutes? Why are we changing it, Spec? Was Cal right?
No. So actually they're getting enough stress, which is what I want. I want them to go hypertrophic. I want my muscles in my arms to go hypertrophic. The thing is, I don't want them to break down. So I don't know. I don't know how many that was. I have been at failure. I have been at failure, dude.
No way, this motherfucker. You'll be fine.
I'll be fine.
Spec, you'll be okay.
Like
I mean, you can just go to a doctor.
She's seen my muscles before.
It's true, I have.
Yeah, no, this is definitely CV and V3.
Spec did like 5 out of like 40.
No, I did more.
Sorry, 7.
No, I did like 12, dude.
Oh, 12 out of 40.
12 out of 40. So I'm just taking a break. I kind of forgot how many. I lost count after a while because I just kept doing it.
Vanny says 6 out of 67.
It's helping. It's definitely helping. Don't worry. But yeah, no, like my muscles used to be larger, and I have lamented that fact that they are no longer as large. So you know what? This is gonna help.
It's true. Oh, Vanny's doing a news report. Breaking news.
My arms are yoked.
Now we have 10 residents, and so we have the report of the island vibe. It is an enthusiastic island.
Nice. Mine is an emotional island. Everybody has a lot of emotions. For some fucking
Y'all have
reason.
problems.
I know. This is definitely Reaching Reigns. Don't mind me. I'm just trying to like click on it while I'm also trying to fucking do these fucking girls.
Wait, oh my god. Wait, Spec, I'm gonna send you a picture of you hanging out with your little ghost friend. Oh, he's so cute. Where's Spec?
Interleukin. Okay. Elevated levels of CRP. IL-1. Okay. Yes. 51 if I included. Okay, I mean, yeah. I've just been doing them. I haven't stopped. I took a break for like a few minutes and now I'm back to it. So, okay. Bone wanted to do the baby, but like you didn't want to do the baby. You didn't want to do the baby. Ema, what the fuck, dude?
Yes, Vanny, we are married now, and you want a baby. But you have not talked to me about a baby yet.
$55? Why? Hema? Jesus Christ.
Let's put a baby in Vanny.
What the fuck?
I mean, Vanny and I did become friends by talking about mpreg at first, so.
12. Okay, 12. I did another 12 on both arms. Left renal artery. This looks like 10. This was like T10, maybe. You know what? Oh, let's just do T12. Oh, L1. L1. It was like almost there. Rip. I know, like, weirdly enough, I have been getting a good pump. I have to show you this later. Holy shit.
Hey, what else is going on?
Okay. Okay, 48-year-old man presents to the ENT with 10-month history of constant right-sided deafness and a sensation of feeling off balance. No past medical history of note. Audiogram identifies reduced hearing to both bone and ear conduction. So sensory neural. Otoscopy of both ears. Ooh! Ooh, I think this is hear me out, Hema. I think this is the neuroma. Vestibular neuroma. You know why? Hear me out. It makes sense. Okay, I'll wait. I'll do another 12. I'll do another 12 on my fucking left arm.
Vanny, you're officially super in love with me.
10, 11. I love.
Thank you, Ralph.
I love this. Okay, wait. Yay! Okay, positive predictive value. I have to do this. Let me do this. Let me do the positive predictive value again.
Bone, I just want you to know that you just asked me to give you something sour. And so I gave you key lime pie and then you hated it.
This is probably going to be so like... I'll do this. 9-4. I did the math wrong in my head.
Now you're pissed at me because I gave you a key lime pie.
Yeah, Hema, I did the math wrong in my head. You know why? Because I can't really type in a calculator when one of my arms is constantly occupied.
I don't have key lime pie. I'm so sorry. Or I mean, I don't have sour candy. Give him a lemon. I don't have a lemon. Oh, Kimmy fell over. Where's Blue?
God damn it. Okay, wait. Anchors in stomach, yes.
Okay, Spec wants me. There's Kimmy.
Oh god. Clotrimazole is... This is sulfamethoxazole and trimethoprim, right? Why do you mean? It's because I'm doing fucking bicep curls.
No, do it. Do it, Bone.
This is because I'm doing fucking bicep curls, you guys. Jesus. I don't fucking goon. Excuse me. I literally do not. Look. Okay. 60-year-old man suffers from fever, headache, and a cough. Okay. I'm taking a rest on my that arm. Okay. Ibuprofen for these symptoms. Yeah, PGE 1 and 2. Or 2.
You see?
Antibiotic effect. No, this looks like PGE I2. What? I would never. Oh no, you're right. It's E2. It's E2, unfortunately. It's E2, unfortunately. Finasteride, so this is a alpha 5 alpha. Oh wait. Is finasteride an alpha 5 alpha reductase inhibitor? Is that what that does? Is that how it does it? Because I kind of forget. I think it is that, but I'm gonna have to ask you just to double check me. But do I really look the kind of person that would do that? It's A? Okay, so I was right. But I don't do whatever the fuck you're accusing me of, Vanny. What do you take
It's
me
not
for?
to microbiology, it's to organic bio.
That's even worse. If it's OChem, I'm dying. No. If it's OChem, I'm...
It'll also be featured.
So Bone, we gotta have a talk. What the fuck? What the fuck? What the fuck, dude? Okay, wait. Muscular cutaneous nerve. Wait, let me read. Yes. Wait, no, radial. Rads. It's the rads. I literally don't do that.
Vanny is currently doing karate overlooking the ocean.
Good. He should jump into the ocean.
Crazy. Crazy thing to say to my husband.
No, radial nerve is brachiorads. Musculocutaneous is biceps. It's literally clickbait, though. Yeah. Musculocutaneous is biceps brachii and brachialis. That's like why it's my favorite nerve. Musculocutaneous is my favorite nerve. I love working upper arm. God, I should probably put lateral raises in the fucking thing as well. I should put lateral raises in the redeem. Should I? Cals, should I? I feel like I should.
I think you should, but maybe you should limit it this time.
Yeah, I'm gonna learn to limit it this time. So she's given escitalopram. Doing all these bicep curls makes you want to do work on your arms too. Here's the thing. Everybody should do some sort of weight training and everybody should do some sort of cardio. Do we have the time? No. We make the time. That's why I have this now. Also because, like, I can't do it in class. Like, I can't bring a fucking barbell with me to class.
You could.
I don't think I could. I'm gonna be so for real. It is an SNRA. So, what? What hypothesis? What are the... You know what? I'm gonna send this question to Lev and be like, help. Lev, help me. MOA hypothesis? Fair. Okay. I see. I see now. I see what you mean. First of all, the medial wall of the femoral canal. Oh god. Femoral canal. Oh my god, this is so much anatomy that I don't remember anymore. The femoral canal boundaries. There's a fucking mnemonic for this, and I'm trying to remember it right now. Let me think. Let me think. Let me cook here. NAVEL. Navel. So the medial wall is... Let me think. I know it's a ligament, but I'm trying to remember which one. Yes, it's the lacunar ligament. It's the lacunar ligament, not the inguinal ligament. Inguinal ligament is, I think, the floor. No. Inguinal ligament is the anterior border. Then we have the femoral canal. The pectineus is the posterior border. The femoral vein is the lateral border. And then the lacunar ligament is the medial border. Okay, got it. Okay. Worsening weight loss, heat anxiety, heat intolerance, dry skin, dry eyes. Okay. Yeah, go ahead. Set doses set. Okay, so she has hyperthyroidism. Further thyroid testing is here. I'm gonna wait for you to come back before I do this, and this will be the last question before I do some actual work stuff, which will still be on screen, which won't be on screen, but I'll still be yapping, and unfortunately suffering. I still have to do all these fucking girls. Six, 7, 8, 10, 12, 14, 15, 20. Okay. I am right? Like, the best way to, like, build mass is high reps, low weight. Right? Right? I'm trying to remember. I think that's the way. That is the way. But also, Rao, congratulations on winning the Battle Royale. But oh my god, my arms are, like, not killing me. They actually feel pretty good. I actually miss this. But also now this just makes me want to get, like, higher weighted weights. Because, like, 2 kilograms can get boring after a while, you know? Like, at some point I'm gonna have to, like, fucking increase the weight to, like, maybe from 2 kilograms to, like, maybe 5, and then maybe 10, and then at some point I'll just be able to do, like, casual fucking Twitch redeem number of reps with like a 20 kilogram weight. I don't know how much that is in, like, pounds. 20 kilograms is like 40 pounds, right? Oh no, hey, how are you doing? We're doing some Q-Bank. Before I have to do, like, some research bullshit. Titrate up the drugs if patient comes to you for that road. I'm pretty sure... I don't know if it's this or this. I don't remember. Oh, never mind. It was number 3. Or fucking D. Oh well. Oh, it was carbimazole. Fuck. Thanks. Thank you for checking in, and thank you for stopping by, and thank you for lurking. Jesus Christ, my arms. New antihypertensive drug across various randomized control trials. Visually represent the effect size and confidence in. Oh my god. Effect size. Pretty sure this could be histogram? Oh, it's forest plot. What is a forest plot? Loki? I don't know what that is. I don't really do meta-analyses, so we're gonna find out what a forest plot is. Oh, that's a forest plot! Oh! Okay, that makes sense now. That's annoying. Oh, your lethargy. Hyperosmolar hyperglycemic state. Estimated serum osmolality. I don't know how to do this. I forgot how to do this. I forgot how to do these calculations. I don't want to do it. That's the end of the questions, I think. I think that's gonna be the end of the questions. Because I still have to do like actual work stuff now. So I'm gonna close out that window. And we are gonna switch over to SPSS. Now I can just look at my SPSS while I'm doing this shit. Okay. Alrighty, I hope my SPSS like doesn't die. SPSS, don't die, please. I need you to work. See, if you don't, I'm gonna crash out.
I'm looked into my game right now.
Oh my god. That's okay. I'm literally just opening up my research file so I can like work on that right now.
That's valid.
Yeah, I'm gonna open up my output. Gonna have to open up my output and all this shit. I have to like, how do I hide a variable? So, oh, okay. Select cases. Use filter variable. Where is the nominative? Where is my nominal variable of names? How do I remove the name variable? Reset, cancel. I'm just gonna like... I'm gonna open up SPSS. I have SPSS open. I have to open up my output that I made recently. Open output. We're just gonna open up some crosstabs so I just have something to look at while I work on this. So basically, we're gonna do some fancy stats shit now. Where's my SPSS though? There we go. Oh, welcome back. I kind of finished with QBank because I have to actually work on this stats thing because I am the statistician for my fucking, like, my section group's student project because we have to do, like, a research project in second year. They didn't want to pay for a statistician, which means I get to be the statistician. Which also means I have to, like, review everything and, like, work on fucking Q&A bullshit, so it's like... Nature talent. Example, what co-founders were not controlled? I have to read through all this paper again and all this shit. Yeah, of course. Have a good day, Hema. Thank you for sticking around. I know you mainly stick around. Why would you do that? Jesus Christ. You want to torture me again? Fucking hell.
Did you just get more girls? Is that what just happened?
Exactly.
Amazing.
It's okay though. I actually am getting a good pump going on, so it's not too bad. It's not the worst thing that could happen. Though I think bicep curls I could just keep doing forever. What I cannot do forever are lateral raises, which yes, once I figure out how to make a cooldown happen, I'm gonna put a cooldown on it. I have to put a cooldown on that one.
I can show you how to do a cooldown. It's quite easy.
Please.
I'll show you.
Thank you. But I think I'm not gonna put a cooldown on the curls. Despite the suffering that I'm in. Because like it's pretty good. It feels good. It feels good. I miss working out. And if it means I have to like throw things at me to like make it happen, I'll do it. Fuck it. Oh wait, oh my god, yeah, no. Yeah. Okay. So, let me read through the paper again.
I'm gonna fix her shoe.
Complete draft. And here.
Not purple.
Okay. Have some outlines. Perfect. Okay. Yeah. So now I can actually like talk about my study shit that I like doing, like my research shit. It's not really my project, but I am actually pretty happy with how it works. With how it worked. Rico might actually find this very interesting. So the project is called "The Hidden Cost of Being First: A Comparative Study on Burnout Levels Between Preclinical, First Generation, and Non-First Generation Medical Students at my university." It's a manuscript that's going to be submitted in partial from one of the course for family and community medicine. Okay. So the background here, medical education is academically and emotionally demanding, placing students at high risk of shit like fucking, let me read it. Let me actually read it. At high risk of burnout. While first-generation medical students, FGMs, face unique hidden costs, like limited mentorship and financial pressure, there is a critical gap in the Philippine literature regarding their specific mental health needs. The objective of the study is to determine if significant differences exist in burnout levels, coping strategies, and perceived social support between FGMs and non-first gens. And so, cross-section qualitative design was employed at my school, surveying 180 preclinical medical students. Grade levels 1 to 3, selected through stratified random sampling. Burnout, coping, and support were assessed using the Maslow Burnout Survey. Maslow Burnout Inventory, the student survey, brief cope, and multidimensional scale of perceived social support. Our general results were that we found that burnout was identified in 16.7% of the cohort, primarily manifesting as high emotional exhaustion, but unfortunately no statistically significant difference in burnout severity was found between first gens and non-first gens. Problem-focused coping significantly correlated with higher academic efficacy, while avoidant and emotion focus were linked to higher exhaustion and cynicism. Perceived social support was high, but not significantly associated with burnout levels. Our general conclusion is that generational status is not a primary driver of burnout, as the rigorous preclinical curriculum likely acts as an equalizing stressor for all students. Institutions should focus on promoting adaptive coping mechanisms and implementing early screening for emotional exhaustion to ensure academic success is driven by resilience rather than familial background, which, yeah, no shit. Though, the co-founders that were not controlled, I think I would have liked to control for, like, finances, maybe? But yeah, so finances, residents, dorming, like if whether students were dorming or not, possibly presence of already existing emotional issues. So like, that should be presence of pre-existing mental disorder. Okay. Wait, or did we actually do that? I have to look at the paper again. Another possible one we could have controlled for or like accounted for in the variables could be what's it called? Prior experience in like the healthcare field. Because if these students have had prior experience, they probably they would be like more versed in this stuff to where they do not feel as much burnout just inherently. Or they could be even more burned out. Who knows?
Vanny is becoming friends with you now, Spec.
I'm so glad.
Yes. He's telling you why he's a healing presence.
Ooh, amazing. But yeah. I'm glad that he is a healing presence, and I'm glad that I'm becoming friends with Vanny.
I know.
He just needs to get those feet away from me.
Yeah.
I don't want that. I'm sorry. I'm not into it. I'm not into that specifically. Never have, never will. Okay. I can do one here. One here. Okay. Co-founders were not controlled.
I got a weightlifting DVD that I can give you.
Please do. Please do. Thank you so much.
Oh my. I just noticed I can.
I'm so happy that you can.
I need to level you up.
You should absolutely level me up.
Oh, you're talking to Vanny.
I am talking.
No one really gets dancing. That's what you guys are saying.
Oh, what? I mean, I can't dance. IRL. This is canon. This is canon spectral anomaly lore. I cannot dance.
That's so sad.
I don't know how.
Blue and Bone are talking. Bone considers Blue a good friend. Blue is not getting along with Bone.
Oh. Oh no. That's real. Lord. Okay. Okay, I think I got to 50. I think I got to failure. I'm almost to failure. On both arms. I'm like... Fuck. I'm just also trying not to like... God damn it! I'm literally almost there. Alright, okay, you're just trying to get me to failure. I see. I see. Thank you. I understand. Okay, my arms are done. Okay, okay. I think I did all of that. I have been doing a lot more. They already are! They feel like they don't exist anymore. Like they're ghost arms. That's.
I mean, haven't they always been?
They always have been, yeah, that's true. Jesus Christ, Bone. Why the fuck? Ew. Or... Okay, okay.
The train is arriving, so I have to hop off for now.
Alright, bye, Cals. Have a good day.
Bye. Bye, Spec. Bye, Specs chat.
Everybody say bye to Kel. If somebody could give Kels a shout out, that'd be cool. Bone. Instead of like torturing me, you should shout out Kels. Please.
And then you guys can torture me tonight. Tonight's gonna be Cat Mario, among other things.
Oh my god, you're actually playing Cat Mario. I'm so scared for you.
Yeah, I'm scared.
Lord.
So okay. Goodbye.
Bye. My arms hurt now, guys. This is what you did. Or jelly. I can't type. Can't type. I can't type anymore. Fucking wee. You didn't even shout out Peach Demonade. What the fuck, man? What the fuck? You should shout out Peach. I can't, I'll do it. There. Shout out Peach. She's cool. Follow her. We love her. You just type in @Peach. And then it auto-populates. Also, hi Blue! How are you doing? My arms hurt now. My arms hurt a lot right now. Because it's self-inflicted. Oh, fucking god damn it! You're not allowed to. And also, technically you're a ghost, so you already have transcended the mortal coil. Like, you already have transcended the mortal coil if you wanted to be, like, super nerdy and pedantic about it. But I understand what you mean, and I am sorry. You're going through a rough time. How long will the jelly arms last? Delayed onset muscle soreness? It'll probably last until, like, I don't know, fucking tomorrow morning. I have to, like, put my arms in, like, cold water after, that way to make it, like, feel a little better. Because they are warm. I'm gonna just say this right now. My arms are hurting. And Blue, where do you have PPE at home? Please wear a mask next time. Insulation is bad for your lungs. Like, you're breathing in basically fiberglass, dude. That is not Gucci. Wait, what mask do you use? Maybe there's like a better mask that you could get? Okay, fair enough. Breathing is important. Maybe there's like a better mask for you that would help, like, with the insulation, because, like, yeah, I understand your dilemma here. Breathing is kind of awesome, I think. I believe. But yeah, so let me, like, go through this really quick. I can't type anymore. Oh shit, somebody followed. Hello, Adele14. Hey, thank you so much for following. How are you doing? If you're in here, I hope you're having a good day. All I'm doing right now is doing some study shit. But I'm Spectral Anomaly. Med student, VTuber, constantly exhausted, and I'm just here. My arms are jelly. I have no upper body. It's gone. Y'all did that. And honestly, it doesn't feel too bad. I like doing upper body workouts. Always have. I'm literally not even joking. Like, I love upper body. Eventually, my arms are gonna get so yoked again. Oh my god. Holy. Maybe I'll be able to, like, get back to being able to hit my PR. Get back to my PR, my old PR. Of, like, a 90 pound bench press and a fucking 160 kilogram, like, deadlift. I want that. I want that again. But yeah. Let me see what's going on here. Let me see what I can do. Yeah, so that's up right on the door scale. I have to look at the manual. Sample questions. Document outline. Wait. Oh. Oh, I need to message my research partner right now. Actually, no, I can message her tomorrow. I'll message her tomorrow. Because I'm like, technically we can just take a screenshot of this thing and then use that instead of what we were currently doing. I think I'll have to ask our preceptor about this. I'll have to message him or something because like technically it's due already. But like yeah, I'm thinking about it. We could definitely do that. That would actually be a viable option. But yeah, so this is what I'm thinking here. I don't really have anything else to really yap about except for like my research right now, but I can explain what I'm talking about here. So with the research project and everything else, what we did was we threw a test battery basically at students. And as a part of the test battery, we gave them the Maslow burnout inventory for students specifically. We gave them the brief cope to find out their coping skill, like what coping skills that they turn to or they lean towards. And we also used the moral support skill, the measure of perceived social support, to like see what kind of support these people get or what these people use. So with that in mind, we were able to actually see, number one, who are the ones that are at risk for burnout? Who are the ones that are currently burned out? Who are at the threshold of the burnout scores? We also found out what coping skills they were using the most. We also found out like what they don't use as much, and we also found out their perceived level of social support. And everybody's level of social support was like went from moderate to high. So everybody has a lot of a lot of social support. So it's the burnout shit isn't happening on that end. The burnout shit isn't happening, and the coping skills or the coping skills are just like a result of the burnout here. They're like ways for you to mediate your burnout. Or to prevent yourself from getting into burnout. But when you're burned out, you're gonna keep doing your coping skills. Some of the ones that were doing their coping skills, they're not really, some of the ones that were burned out, they were using like the avoidant coping skills where like they're just trying to avoid the problem versus like head on face it. Those that were doing the head on facing it kind of coping skills, there were a few that were still in the burned out category, but those were not the ones with the high cynicism. Those were the ones with just high emotional exhaustion, because there were two categories of burnout here. There was the category of just straight up high emotional exhaustion, or there was the category of high cynicism and low academic efficacy. So basically what we found is in the cohorts and like in the amount of students here that did this, only 30 people were burned out. And then we found out like how they were burned out and what coping skills they use and their level of social support. And a lot of high social support, so we could just kind of take the social support away from from what the problem is, like where we can isolate the burnout stemming from. The burnout is stemming from med school. It's stemming from med school. Though I would like to see more of like why and how. Because like Maslow has this thing. It has like they have like a stressors in like a work stressors like survey, and I wanted to use that, and like our preceptor was talking about maybe we could have used that, but there's none specifically for students. What we could have done is we could have retooled it to try and be for students, like have more student geared questions, which is what they did with the MBI SS, which is what they use with the MBI SS. Also, guys, have you heard of the hantavirus thing going on? I'm kind of scared. Oh, there was hantavirus found on a cruise ship, and there was like some evidence of like a human transmission. Don't panic yet. Just read on it, but also just do basic PPE bullshit, like wear a mask. Don't fucking do crazy shit outside, you know. Don't go out when you're sick unless you can't really stop it or help it, you know. A lot of things you can do to mitigate like your risk of getting sick in general. But yeah, I'm a little spooked about the hantavirus thing. I'm a little spooked, not extremely spooked, but I'm just a little bit. Just a wee bit. Just a wee bit. I don't really know what to think about it. I'm just gonna wait to see what happens because I don't know what the fuck we can do. But yeah, actually guys, I think it's time for me to end. But yeah, so I hope you guys had a good day. I hope you guys have a good day. I'm gonna take a nap. I'm gonna sleep because I have class in the morning because exam week is over. But I'm gonna have more exams soon. Don't you fucking worry. I will go eat. Who's streaming, by the way? Who's live? I see Seppa. Anybody else? Is it just Seppa? If it's Seppa, I'm gonna go right out to Seppa like I usually do. Alright. Alrighty guys, you know who I am. I am, once again, Spectral Anomaly. I'm a med student, the VTuber, and the ghost currently haunting your first, second, or third monitor or your phone. Alrighty, have a good day everybody. Bye!